What's going on?
What's up? What's up, my brother?
What's up, man? What's going on?
I'm doing well. How you doing today?
I'm doing good, doing good.
Looking good, looking good. Life treating you all right today?
Yeah, yeah, everything's going good, man. Just getting
That'll work.
everybody up and running, man, and just making
That'll
sure
work.
everything's posted. Yeah.
Okay, that'll work. That'll work. We can do this. We can do this. I'll try not to be too nervous and be shaking too much. So,
Oh no, you good, you good, you good, you good. You on the post. You on the
yeah, yeah,
post.
yeah. I get nervous speaking in front of people. So I
Yeah.
gotta. So we'll do it. We'll do it.
Okay. That's good. Let me see if everybody's up and running. Okay.
Let me
Let me see. Okay, we good to go. Let's see if everybody else is in. Okay. Yeah. Let's get everybody rolling here.
Let's see if I can see.
Sir, how are you?
Hey.
There she is.
Everything, how you guys doing?
I'm doing fantastic. How are you doing today?
I changed it up a little bit.
Hey. Oh, okay.
I gotta take out one of these. Everything, how you guys? Is that better? Yeah.
Yes,
Yeah.
ma'am.
Okay.
So today's topic is about what first aid kit is right for you.
There we go. An
Mm,
important topic, and it's like you said, right for you is a key phrase for you,
Mhm.
because that's most important. Everybody's is going to be different, so
for sure. Is there anybody in the room?
No, I don't see anybody.
Yeah. I think you might wanna wait till they come in a little bit
Okay.
first
Yeah.
before we start. Otherwise, we're gonna have to probably repeat everything. Yeah.
Well, I got it posted. This is the one posted.
Okay.
Got 5 more minutes for it,
Okay. Cool.
Make
I
sure.
actually got a notification for you. My notifications for you are working at least.
Okay, that's good. That's
You know,
good. Okay. Oh, welcome, welcome. Tap In Productions.
Hi,
What's going
Tevin.
on?
Ben, what's up?
How are y'all? Ooh,
All right.
these things back.
Yeah, that's good.
Here. How's your Saturdays going?
It's going good for me. Just looking forward to this long weekend. Of course, my son just said, "Oh, by the way, I need this for a project." Like, yeah,
Oh,
I was like one of those.
oh, okay.
So I got 2 more years and no more of that. So I'm just trying to keep him on track for 2 more years. He goes off to college, and so
That's good. That's good.
Oh,
so
it still continues.
I know, I know. I have a 31-year-old and a
Oh, okay. So there you
21-year-old. So it never ends. So yeah.
I feel
Uh,
Oh, okay. So there you go. I'm sorry. I'm trying to turn this
it.
down. Okay, there we go. So, survival Saturdays. Look what's going on in the world with Louisiana, New Jersey,
that's crazy.
New
Yeah.
York, Philadelphia. So many places are being hit
Yeah.
so hard, and we are so unprepared.
Yeah, I
That's
mean, they
so
show what
true.
happened in New York with that flooding and those basement apartments. I'm like, who? I never knew that could be a possible issues, and
Yeah.
that they the
Yeah.
first time had to issue flash flood warnings
Mhm.
for New York. That's how bad it was. That's
No,
insane.
it was like that with what
Did
was
that
that?
one that came a few years back? Did they do
Yeah,
the same?
and it did the same thing. So
Let's see,
it's like, when do we plan for the next one? Since they're happening so much more frequently than
exactly.
that, rebuilding all of those stations just for it to happen again. Did we put in a plan to alleviate water should it happen? some
Yeah.
type of draining system that would work better.
Yeah,
Oh,
that's so true.
Yep.
What's going on, Big Dre?
Big
Everybody,
Dre.
Dollar?
Yeah.
everybody.
Yeah, Bill?
Well, look at Texas. In February, we lost, that had that power issue. The same thing happened 10 years ago, and they still haven't done anything. They gave us guns. They gave everybody guns to kind of distract folks.
Yeah,
But the power grid is still,
yeah.
Jack up. That's
ready to
crazy.
go out. Just when one drop of snow drops, it's ready to go. So, yeah, we
Yeah.
got to be prepared. We have to be prepared.
And I've been doing some homework and noticing the ammo prices online have skyrocketed.
Oh, yeah. They're going to use that as an opportunity to price gouge and, get
Yeah,
people who are panicking and, so they're always going to pull that one out of the hat. So,
Remember they did that the last time the pandemic happened.
yeah.
The price
Everything
of
just went.
all went up. Yeah. It was just a little tiny window that they gave you a break, and you had, if you didn't grab what you could grab
And that's
then.
the thing. Yeah, we had maybe a month, maybe, even if that. We had
yeah,
maybe 3 weeks. And then,
yeah, that's so true. That is
Yeah,
so true.
crazy.
so,
Okay, so we have a few bodies in here. We can start on what first aid kit is right for you. Some people might not know out there in the real world what kit to, grab and have, which
Uh-huh. So there's so many different kits. You got to figure out. Well, you should have more than one kit because you never know if you're gonna need one for the car. You're gonna need one just for certain items. A kit. It's called a medical kit, but it's we were actually I asked you the other day on Black Point Dexter, how do you keep medication that needs to be cold during a bug out situation? They actually have bags that come with the dry ice.
exactly.
Also it's insulated. There's one that you can plug in to your car and keep like diabetic medication cold,
There
some
you go.
specific medications you may need.
There you go.
Yeah, so that's a whole nother kit. It's a medical kit where you keep all your medical supplies because if you have sharps with the needles, you're gonna want to keep that separate from anything else in case you have to send the kids to get the bag and
Exactly.
you don't want them to go in there, and then it's a problem. But then you have your car kits, you have your trauma kits, your IFAC kits, regular first aid kits. You have a burn kit where it's just 4 burns.
Yeah.
What else you got? What you got for Dexter?
What I was going to do is just run through my basic setup. Of course, I'm going to put a disclaimer out there. I'm not a medical professional. I'm not a physician. I don't play one on TV, though I could have, and I will tell that story one day. I could have been Denzel for real. I'll tell that story. But anyway, we'll go ahead and go through
okay.
through that. Medical, not a medical physicians, but do have some experience. My background, I have 15 years of experience as a respiratory therapist, working in a neonatal ICU, adult pediatric, and ICUs, also emergency departments, several certifications, been on the cutting edge of a lot of technologies that are developed and being used right now, like for COVID, ECMO, extracorporeal membrane oxygenation. We worked at that at Loma Linda. There was a certification course back then in the day trying to find ways to ventilate people beyond what a regular ventilator can do. And
Yeah,
they're finding that modality is of extremely good use for COVID patients because you're not, doing all the barotrauma. I won't get into all that, but so I have experience with that. In the Air Force, I was an EMT ambulance, so I was EMT certified. Also taught ACLS, Advanced Cardiac Life Support, and Basic Cardiac Life Support to the troops and the physicians. Developed all technologies in the Air Force at Wolford Hall, which was the largest medical facility in the Air Force. We worked on a lot of technologies for the cardiopulmonary department because they don't have respiratory therapists. They have cardiopulmonary technicians. So they had to get them up to speed on, hey, this is what the civilian market is doing. They're cutting edge. Here's what we need to be moving towards. So I have 6 years of experience in that. So I have a little bit of experience in the medical field. I've always been into first aid. I was a Boy Scout. Be prepared was the motto. So it started way back then, and just been continuing to stay educated in that field, keep my certification for respiratory therapy up. And there's always new things. And the great thing is YouTube. There's so much information out there right now. There's no excuse for why people should not be educated. That being said, This little pamphlet here is a first aid guide. You want to get educated really before you even start buying stuff. You want to have information. If you don't have information on how to use what you have, it does you no good. So get information. This little first aid guide is excellent. It comes in the kit that I got off of Amazon, and talks about all forms of first aid. So sit down, read that, get that information, or if you like it on video format, tons of stuff on YouTube. I'll just run through some of the things that I have. Everything we talk about today, you talk about different kits. This is my personal kit that I carry every day. It has a tourniquet on the end of it, and everything that we're going to go over on the table here is contained in some form in this kit. So this is with me at all times. So this is like nice and prepackaged, has all that stuff in there. Of course, once you get more information, like Carbon said, you can go to the big bag. I have one in my car, so this is like my take care of everybody else bag. It has multiple things in there. But for right now, we're going to talk about something that you can easily carry. If you don't have this, put it in a plastic bag, put it in something, carry it with you. So you don't have to have all the fancy schmancy, Gucci stuff, but have your supplies, have them, organized in a way that works for you. So don't let that stop you. Well, I can't afford the bag, this, that, and the other. Get the stuff, organize it in whatever way you can, and then, work up towards getting, the packaging and all the other stuff. But have the stuff, train on the stuff, be educated to what you need. I'm just going to go 5 minutes real quick. If people have questions, we can run back to them, but I'm just going to go over what I feel is necessary for me in my bag, and then it has worked for me over time. First thing is gloves. First aid is very messy. It can be very messy, so you want to protect yourself at all times. And these come in a lot of the kits. You can get them and restock them. So as you use them, you can set stock levels and reorder those. So you want to have gloves. Another thing that I have in there are bags, plastic bags. This can help to make sure your stuff is waterproof, so you can get it, seal it, and you're good to go. If somebody gets a tooth knocked out, a kid gets a tooth knocked out, you could put that in the bag, put it on ice, or say, God forbid, somebody gets a finger, cut off. You will have a place to put that beside your pocket. So you could, if you don't want to touch it, put your hand inside the bag, turn it inside out. It's touching somebody's finger is not a good feeling. I've had that experience. You don't really want to touch it, but you want to have a place to put that, and then you can time and date it and all the other stuff right on the outside of the bag. So bags have multiple uses. That's another thing. These are tools. I recommend everybody have a knife in their toolkit. Knife is very important because say you run up on a motor vehicle, you can have this knife, which also has, both of these knives that I have here have glass breakers on the end of it. So anytime I'm going to be in that situation, in my bag, I have a knife that has a glass breaker. This is an out the front knife, very light, easy to use. It also has a serrated there. So it's very good in cutting seatbelts and stuff like that. There we go.
Did you have the seatbelt cutter on this one? Does it have the seatbelt cutter?
It has a seatbelt cutter, yes.
This one came with a flashlight.
Oh, she's always more prepared. She's always, so I don't have a flashlight.
I'll be right back.
So your tools are extremely important. If you come up on a motor vehicle, you have to get out of a motor vehicle. If your windows are down, say that flooding situation, you have to break the glass. You can get your door open because of that pressure. You can just go ahead, boom, break that glass and get out. So that's part of your first aid kit for yourself and other people as well. If you had to get in a vehicle, have that glass, having that glass breaker on there could be key to saving somebody's life. So that's just a couple tools.
This is the one, your first aid kit for the car?
This is in my first aid kit that I keep with me at all times.
At all times, okay.
So the car, I always keep one on me. This is my EDC in my pocket. So I probably will have this in my pocket, this in my kit. Because this is high visibility, it's orange. So if you're in a car and it's dark or in a smoke situation, if you drop it, it's easy to find. So that's why I picked orange for those type of situations. So this is bag, the other ones are car. I can fit it in my pocket because it has a pocket clip that seats very regularly. So a lot of my knives will have that feature as well. So this is kit. This is always in my kit. So those are those two. And then, of course, pens, so you can write stuff. You can write on those bags. You can use, if you don't have paper and pencil or if it's wet, you can write on those plastic bags, write notes, times, stuff like that on those bags. But you have to have something to write with. So that's also something. Other tools that I have in a bag named tools, conveniently, I have hemostats, scissors, tweezers, and a scalpel in this bag, and everything is in a watertight bag. So
Good
that's
to
just
know.
something you could throw together. Whatever tools you feel you need, go
Yeah.
ahead and do that. So those are things that I have that are in my tool bag. Of course, band-aids.
Yep.
This is a 100 pack, 25 of 4 different types. So you can't go wrong with that. You don't have to keep 100 in there, but you can scale it up, scale it down as you need, but you want to have those things. And then we're going to go to dressings, gauzes. So that's another pack of non-woven gauze sponges that
Mhm.
can be used for direct pressure. It could be used as a dressing that you put, tape or another type of dressing over, but you can use it for direct pressure. And these open up very easily. You take them out, boom, put them on the wound, cover it up, or it could be used on a burn. So, and it's good that they're non-stick. So you can use them for multiple uses. So whatever number that you want, you can tailor your bag, whatever size. It can fold up, very easily storable. So that's the other thing. Another thing, pressure dressing. If you come across somebody with a wound and you need to put pressure on there, this is a very dense pressure dressing. They come from a lot of different vendors. I'm sure Brother Ampu is probably going to have some of this stuff up on his site, but a pressure
Yeah.
dressing is key to stopping the bleed, and of course, taking that stop the bleed course will teach you how to use it, but you basically put that pressure on there and that can save somebody's life until, help can get
Now,
there.
is that also for specific wounds or what?
Well, anything you typically you can use on any type of wound
Yeah.
extremity. You could also put it over chest or abdominal cavity. Anytime you
Okay.
need to try to put pressure on. Trying to put pressure on an abdominal or thoracic wound is sometimes problematic because they're soft structures. So you're putting that pressure on, that bleed is still going on internally. So you don't have bones and stuff to press against. But you want to put some type of pressure on there besides going to a next level as packing a wound, especially if
Gotcha.
it's a thoracic or abdominal wound. You can also pack, wounds on the extremity, but typically it's like direct pressure first and then, go from there. So you have to assess the situation.
Yeah.
One of the biggest things I like, Boy Scouts used to wear those triangular bandages. I don't know how many of you were Boy Scouts, the little thing around your neck.
Oh
That's a
yeah.
triangular bandage. They teach you
Yeah.
how to make a sling out of it. They teach you how to put a pressure dressing on with that. They teach you so many things. You could use it as an emergency tourniquet. So pressure dressing, these things are triangular bandages. These things are dirt cheap. And if you don't know how to tie a knot, they even include a safety pin on there. So I don't know if people know how to still use safety pins. I haven't seen any.
Yeah. Hey, I'm
But
old school. I agree.
yeah, I'm old school. So, I recommend you have those, at least multiple of those in your bag. So
Good to know.
we're going to go on to other things, peripheral things. We talk about wipes. So I have alcohol wipes in here, bee stings. They have their bee sting wipes, bee sting kits in there. They have benzocaine in there to help with that. And then you have also iodine or iodine-based solution in there to clean wounds. But you want to be careful with that because people can be allergic to that. So if your
Okay.
patient's not awake alert, you may want to stay away from using anything with iodine on it, or if you don't know that they have iodine allergies. So the alcohol wipes are good. The sting wipes are very good, and these come prepackaged. You could also make these or use alcohol or wipes and create your own different substances you can use to make your own. But you want to have those kind of things convenient. And then, of course, a little small cut kit. You talked about having a cut kit. I always make a little cut kit for kids with bandages already prepackaged in there and antibiotics and stuff already in there. So like you said, you need to tell somebody, hey, go get my cut kit. All they have to do is go in the back, bring this back. So that's already prepackaged and ready to go. And then, of course, a burn kit. You talked about a burn kit. I have nonstick dressings in here. I have Tegaderm in here, so you can put that over to protect the wound because the skin is the first line of defense. So you don't want that open to the environment. So you can put this. They have the pre-moistened ones that you can have for smaller wounds, and then the Tegaderm to protect those larger wounds. They come in all sizes. So I recommend everybody have something like that in their bag. And then they have this also prepackaged dressing that you could use to put over it. And you can always buy, aloe vera gel.
Yeah.
Where you see this is being used, so it's halfway done. So,
Yeah.
so there's always more than one way to skin a cat. Although I'm still not sure why people are skinning cats, but
Yeah.
that's
I got a question for you, Black Poindexter.
Yes, sir.
It came up. The Trill Virgo asking the question: how do you treat a bullet wound? in the
Well,
abdominal area.
Well, it depends. The first thing you want to do is, okay, when you get into the patient, the first thing you want to do is you have to stay calm. And I didn't talk about emergency activities. Before you do anything, first thing you want to do is stay calm. You want to check and secure the situation. Check and secure the perimeter. Because if somebody got shot, that means somebody shot that person and they may still be around. So the first thing they teach you as an EMT, when you go into a situation, look around, make sure you don't become a victim. Now that's two people who have to be treated. So assess the situation, make sure it's safe. Then you're going to go into inspect the person, check the person out, and make sure that you know what level of conscience they are. And then you start treating them from there. So bullet wounds, it depends on what type of things you have. Generally, it's applying direct pressure, like with that pressure pad that we showed earlier. If it's continuing to bleed, especially abdominal wound or something where you have a track where you can follow, you want to try to pack that. We're going to talk about this pack here. This is my gauze and wraps that I use. You see that you have different types of gauze that you can use. You can unravel that and start packing that into the wound. So that's like direct pressure from the inside. So you just take your finger and start pushing that gauze into, the wound, and start packing it as much as you can to try to stem some of that blood flow. But direct pressure works. Also, further down, we're going to talk about quick clots. So all this stuff is available online for training. You want to get that training to know what to do and how to use it, but there are multiple ways. It depends on what's going on, but typically the first thing is direct pressure, assessing that person. We'll get to some of the other stuff, but that's the first line. We've got our tape. You want different kinds of tape. That's always good to have. I like duct tape. That can be used for multiple purposes, but you have different brands and flavors of tape, so have your tape in there because it can be used for multiple purposes as well.
Yeah. And shout out to Black is Beautiful.
Yeah, how's it going?
They love you. RGG.
RGG, what's up?
Jay Smith. Hi, everybody.
Okay, we're almost done here. So I'm going to run through it a little bit more. Some of the things next, cold packs. We talk about injuries, your sprains or strains. First 24 hours, you typically want to put, something cold on there. So these are already prepackaged. You break them, shake them up, and you put that on wherever extremity or wherever that, painful area is, and you're good to go. So I like to have that in my pack. So we talked about sprains or strains. You want to have some kind of splint. These are prepackaged splints that you can use to basically wrap around a finger, a joint, typically, and put it on there, tape it up, and then
Where would you get those from?
Any like those supply stores for medical supplies. I don't want to give a shout out to anybody particular, but they have these online in those medical kits, free-form splints that you can go and put on there. I'm sure Brother Ampu is going to have some of this stuff on there as well. This is like for the extremities. It's just like a foam that kind of holds its place. And you just take your tape and wrap it around it. Now that person is splinted, so it prevents further injury and pain, because say somebody has to keep moving, you don't have time to have them laying down and say, hey man, let's get this split up and let's keep moving. So you want to have some type of material. And with all this stuff, you want to be able to improvise. In the Boy Scouts, they teach you how to take a couple sticks and use a split. So look what's around you. There's so many things around you that you can use, to improvise. So this is all nice and pretty and prepackaged, but there's stuff that you have in your home, in your car, in the environment that you can use. So again, don't let that stop you. Have some plan, and so that you can act, appropriately as needed. So having a plan is very important. We talked about that clotting. RGG.
Hi, RGG.
Hey,
how you doing, brother?
What's going on, people?
How you doing, brother?
Yeah.
Hey, man, I don't do YouTube on Saturdays, right?
I know.
Yeah.
Have I expressed that before?
Yeah.
Many times.
But that tells you how much respect I got for this young man here.
There you go.
I'm here to support. I'm learning. Y'all keep talking. I'm gonna learn. I'm gonna ask me some questions.
Feel free, man. That's what we're all learning. That's
what
the
it's
thing.
here. Survival Saturday.
Let's share this live and see if we can get some more people in here and let's chop it up. I'm here.
That'll work. Okay, so we talked about the quick clot. This basically you put on wounds, put inside wounds. If you have like extensive bleeding that's going on, not just like a little paper cut or something like that. This works extremely well, and this is not based on any type of organic material, so it works really well. It's actually made from a clay type material that helps that clotting, because people with shell fish. Say that carefully. Shellfish allergies. You got to be careful with that. So this does not have any of that
Good
in
to
there.
know.
So you can use that safely. So
Wait.
that's another thing.
Like
Yes,
one
ma'am.
second. The gloves that you were talking about.
Yes, ma'am. Oh,
What
yeah.
type of gloves are those?
Those are the ones that do not have any of the
Latex
allergens,
rubber?
latex, exactly. So again, some people are allergic to latex. So when you're making these kits, you have to read the labels, educate yourself, know what's going on around there, because you could touch somebody who has latex allergy. Now they have an allergic reaction, they're swelling up, and now can have even an anaphylactic reaction. So now you have another problem on top of the problem you originally had. So that's very important. Do your research, do your homework, and know what's out there, what's available. A lot of times those latex ones are cheaper, but
Yeah.
you want to use something maybe a little more expensive to prevent any issues
Got
that
a
are going.
Right.
That's a good question. That's a good question.
I got a
It's a
question.
nice- I'm sorry.
Tap in production asked a question. Can you glue wounds or cuts closed? What type of?
Yes,
Okay.
that's later down on the table. I got it out.
That's good to know.
Oh,
So
dang.
yes, in short, yes, and long, yes. So anyway, we're gonna go back to the wounds we talked about. The quick clot. This is also a spray that you can use on smaller wounds. It will help stem some of that, because venous type wounds that aren't arterial or pulsing, those can bleed a lot too. So you can spray this on a wound, and it works really well. This is made by Curat. You can spray it on there, and it aids in the clotting function. So I like to have that as well.
Good to know.
This is deep.
So
Go
my
ahead.
Black Beautiful wanted to know, what's the shellfish one again? Was that the quick clot?
Yeah, you want to be careful with those, because some of those are made with materials from shellfish, and you can have an allergy that's triggered by that. This one is not. It's made from like a clay type material, a non-organic material that helps aid in the clotting mechanism. So you want to look into that, do your research, do your homework, know what you're buying, and be aware of what's out there. So with all this, you got to do your homework. Don't take my word for it. Like our girl says, do your research. So that's what 32 Icon always says. I go by that 100%.
Right.
So little ammonia wipes. Zach didn't need these when he went down because he was awake the whole time. but it's good to have. If somebody maybe faints or something like that, this is like the first level of, just waving under their nose, see if they wake up. We don't do it like in the old days. We just slap people, just pop, pop, wake up. That's not good.
Causing more injury, right?
Exactly.
Ammonia.
Ammonia. And they have the other ones, the vials you can break as well.
Right.
So so they have little things just to kind of get that stimulus going, kind of clear their head. Boxers, they'll use that, they'll wave that under their nose to kind of get them to get out of that fog. So something just to kind of get them back to a certain level of consciousness and awareness.
Now, where can you buy that stuff from? Anywhere?
Like I said, there are multiple first aid stores where they have medical supplies and stuff like that. I'm sure Brother Ampu has it, but I know Redstone Firearms as a Black-owned business. That's one that I buy some of that stuff from. But if you look up medical supplies, you want to do your research, look for the ones that are rated better, and because some of the stuff that you have out there, like especially with tourniquets, that's one of the things that you should always have as well. I didn't talk about that, but some of those are made, in shops that don't really have the quality control. So you want a good quality tourniquet that you can use, because that's can be used in a matter of life and death. So tourniquets are also something that you always have in your kit, at least one. But I have multiple in multiple places. So
Tourniquets also come in. What is it? It's like Gen 1, 2, 3, 4.
yeah, Gen 1, 2, 3. They're always evolving. They're always evolving. Technology is always evolving. Before we used to use rope. Get a rope and put it around. So that's
It's fitted with the tech, right?
So but so you're always learning, you're always tuning, you're always trying different things to make sure that you're ready and prepared and it's functional for. So what works for you? You want to have to try it out. So, and we always want to use those things and do your research and look at it in a real world sense and get those things. So again, we'll start back. Q-tips. Multiple uses. I keep those in the bag.
That Ziploc bag right there.
Yeah. And then Carbon said something the other day about mask. 2 years ago, I would never have had mask in my bag. You know, now it's something that I definitely keep in there, not only for myself, but for other people for multiple reasons. So masks are good not only for uh, possible, probable prevention or decreased chance of getting COVID, but also other airborne organisms, people coughing and this, and that, and the other. So you can put it on the patient, on yourself. So masks are also good to have in situations, say, where there are fires and you're breathing in particulates that are in the air. You don't want to prevent that. So these can filter, depending on the type of mask, those particulates that are in the air that can cause respiratory problems. So there are different types of masks that you can put in there, but any mask is better than no mask. So that's now something, thanks to Carbon, that I just put in my kit. So
Yeah.
thank you, Miss Q.
On point.
So-
It goes.
And remember, if you're dealing with somebody and they have an injury where they're coughing up blood, you don't want that blood in your eyes,
Exactly.
mouth.
Exactly. So protect
like
yourself.
put it over their face where they can't breathe, but definitely
Yeah.
cup it so that they can still breathe, but then it catches the blood or sputum,
Exactly.
throwing
Exactly.
whatever out of their mouth.
Exactly. For 20 years as respiratory therapist, I've had more sputum on me than I cared to even think of. So I was like, yeah, I'm done. I've had not a good feeling.
I'd like to shout out to Midwest Guns for showing up. Thank you, RGG.
Hi, everybody.
How's everybody doing?
Midwest, hey, what's up, all of y'all? Everybody.
So on my end, I'm almost done. We have like 4 or 5 more items. Somebody was talking about gunshot wounds. How do you treat those to the abdomen or chest? One of the things that you have to worry about not only is the bleeding, but if you have a thoracic cavity wound or even an abdominal wound that can go up, you can have ricochets and shrapnel going into the thoracic cavity. You have to worry about air building up in those cavities, and that could be deadly. It's called a pneumothorax. Basically, you build tension up on one side or the other, and it basically pushes those organs, your lungs, your heart, and also decreases cardiac output. So you want to try to prevent air from getting in from a hole other than your mouth into your chest cavity. So you have these things which are called chest seals. You basically can use these, put them over that wound as you're looking at your victim. You see a wound, just slap one of these over there, tape it down on 3 sides, and you're good to go. So that prevents that air from building up in that cavity. So that's like a long-term or secondary thing that you do. First, you want to treat the bleeding, and then you want to look for and do those type of things to prevent air from going in. And again, there's educational material out there on how to use these, when to use these. But anytime you see a hole, it doesn't hurt to put one on there. In my everyday carry bag, I have just simple plastic on there. Just simple plastic with 3 sides of tape will work excellently because you're allowing it to vent. You're allowing the air to go out of the thoracic cavity and not build up. So typically somebody can go 15 minutes before they start exhibiting signs of tension pneumothorax, but you want to get this on. It's not going to hurt to put it on over that wound, but you can use these, like I said, the plastic bag, cut over there, put it, tape it on 3 sides, and you're good to go. So you don't have to have the fancy schmancy things. You can use things just like little piece of plastic and put it over those wounds, and put one over each wound, and it's not going to hurt anything. So that's that. Ampu, how you doing, my brother?
What's going on, man? Y'all doing
Hey, this is the guy with the web page that
he has. We talked about those supplies.
Yeah, man. Y'all want to go check out some survival gear, man? Just go to KFOS Survival.
Yes, sir.
I got pretty much everything that you need on there. If you see anything on there that you think I might need to put on there, let me know. Send me, contact me, and it'll email me. You can just email me whatever you feel like I might need to put on there. But I think I got pretty much everything covered on there so far.
There you go. So everybody was asking for where you get those. That's your one-stop shop right there, Brother Ampu. So we have it. You know what you need. You're gonna figure out what you need. Now you have a place to go. So there you go.
That's good to know. That's good to know.
There you go.
RGG, what's up, man?
What's good, bro?
Can't call it, bro.
Share the live for us. Share the live for Ben Shooting.
There you go. Almost done. We talked about closing wounds.
This what I was waiting on right here.
Some people have sutures. I've practiced doing suturing, but if you're trying to go quick and dirty, get you some Gorilla Glue. Don't put it in your hair. Put it on the wound, and you can close those wounds and do some quick closing of some of those wounds that
that's the regular Gorilla Glue.
Gorilla Glue. Just put it on there. pinch the sides together. Like I said, there are sites out there to tell you how to do it, and it will hold. It will help to stem some of that bleeding. You put a pressure dressing over it, to help with that. But it's better than nothing, especially in an emergency. You're just trying to get out of a quick and dirty situation. You don't have suture skills, this and any other, because suturing is a skill that you have to practice. This will work fantastic.
What's suturing, man? I'm sorry to cut you
Basically,
off.
taking a needle and thread and closing up a wound, sewing it up. So this takes the place of that. It's quick and dirty. Boom, pinch it together, hold it, and you're good to go.
I've had to use super glue in Afghanistan before. So.
Yeah, and that's simple. That works 100% of the time. It's fantastic. So it's something quick and easy that you can use. So I've had to use that as well.
Just do it. What up?
Another thing, people low glucose. I don't have any M&Ms, peanut M&Ms, but but we do have
no Cerakote M&Ms.
No Cerakote M&Ms, but that'll work. We found that in the field test that Cerakote M&Ms do work. This is just a little quick. Somebody's glucose is low, sugar's low. They're diabetic. They need a quick hit. They can just take a sip on this, and that'll get them back to where they need to be, at least a level of consciousness. So that's something you can pack in there too. So I like to have those. Last couple things. I like to have a thermal blanket. These things cost 39 cents. I had multiple of these in all of my bags. They're good to use. People say you're out in 100-degree weather. What do you need a thermal blanket for? Emergency blanket? You can get hypothermic even in a situation. So you want to have these in. They're good for a lot of different situations. Also, infrared. The guy did a study and was doing that. Hey, they can kind of conceal you a little bit from thermal radiation if somebody has infrared on you. So they have multiple uses, but I always have these in my bag, so they come in handy on multiple levels. Thermometer. This can be used. I keep that in there. Say someone has a temperature, you can use it. You don't have to put it in their mouth. You can put it under their arm, called axillary. Leave it in there for whatever period of time till it beeps. And for axillary, you typically want to just add a degree. So it's accurate. And just add a degree to whatever it says, and you're good to go. So if somebody's, has a temperature, hypothermic, you can do a quick test on that and see where they're at. The last thing what's up? Diesel TV.
What's going on? How y'all been?
I'm just doing good. Diesel in the chat, and you just pop up, and I didn't know you was gonna come in on the screen with me.
He's been waiting for a while because I was late, but I was in timeout. I'm good. We good now.
Just like the police, always showing up late.
Showing up late. I'm not gonna say it. He said
Hey, I'm gonna leave Diesel alone because he my guest tomorrow night. So y'all make sure y'all tune into that.
That's a fact.
So let everybody know on the channel that I just posted kfallsurvival.com.
There we go.
Get your first aid and survival items at.
There we go.
Nice.
Okay, last three things. I know I've been talking a long time. Somebody asked about a rat tourniquet. This is a rat tourniquet as opposed to a cat tourniquet. These things aren't, I shouldn't say aren't, but they're different uses. The recommended is typically the cat generation, latest generation, but these are good, quick and easy to use. They have instructions on the back. They also have a thing that you can scan. It tells you how to use that. And most of these things, they'll have information on there that you can easily access, get your phone, boom, and see videos on how to use it. Again, I'm not a medical professional, but there's information out there that you can get and use. And these things, good things about these are, if you have pets, these things are good to use on pets as well and children. So these are easier to use. The cat tourniquets can be a little bit painful. These are easy to use on your pet. So if you have a pet or a child, these things are quick and easy to use. So
and they take up less room.
So yeah, and so people can be trained on these fairly quickly. So I even though I recommend cat tourniquets, these are also in my kit as well. So multiple tools for whatever purpose you need. The last thing, next to last thing, a flashlight. You could check, level of consciousness, boom, boom, flash in somebody's eyes. There's different things you can use a flashlight for, seeing in dark situations, smoky situations. You don't want to shine a flashlight in like a foggy or smoky situation directly into it, because of course it can blind you just like in fog, but you want to have a flashlight. And then the last thing, one of the most important things, is medications. Everybody's medications are different. Some people have these inhalers that they need to use. So you need to have a supply of medications in your bag or your family's bag, especially if you're a primary caregiver. Have these in your bag ready to go. Oxygen, O2. There's an oxygen shortage. People don't know. There's a shortage of oxygen right now. And a lot of these things, like in New Orleans, they have oxygen concentrators that people use to give them oxygen. But if they have no power,
it can't work.
It doesn't work. So you have to have things in place and be ready to be able to take care of your friends, family members, because if a lot of these people, they're so ill that even without that little bit of oxygen, that can lead to a bad outcome. So have your medications ready. Another thing too, if you have family members, even if you don't, Narcan, a lot of places are making Narcan available. I don't know if you guys saw that video of that police officer that was testing the Narcan, and he had the gloves on and was doing proper procedures. And if he had been by himself, he would have died. But he got into his system. He was out like that, stopped breathing. His partner got the Narcan, boom, boom, gave him a couple of shots in the nose, and literally brought him back from the edge of death. So that's another thing too, especially with the opioid crisis. A lot of our friends and family members are affected by that. Right. So, and they're making it more available. So you have to look at your local municipalities and see where that's available. But that's something else that I recommend people have in their first aid kit. So that's what's in mine.
Let me ask you something right quick.
Yes, sir.
I came in halfway through it. So did you mention about plugging holes, right? I know you said something about what all did you say for plugging holes?
Quick clot.
You have quick clots. You have gauze. You have, those are the two primary. I talked about the quick clot. Some of the quick clots being. I
got two more. And especially if you with a female, because most likely they're gonna have this shit.
There you go. Tampons, yeah.
Tampons and pads.
It works.
And pads.
Those pads absorbent for pressure dressings too.
Pressure, yeah. You use the pad for pressure. Use the tampon to plug it. Yeah. So I have had to do that a couple of times in Afghanistan, and boy,
it's actually easier to use a tampon.
It is because it's the perfect size. Perfect size, absorbent, and you can get it out of there when you need to.
Yeah, because the string hangs out.
It's like perfect. So improvise. You got to improvise.
I've had to do it a few times in Afghanistan, man. A couple gunshot wounds, one in the arm, one in the leg, and then one in the chest. Yeah, and bruh, I put it in and that thing swell up so quick and it
seals and boom. So all these kits and all the prepackaged stuff is good, but like the brother says, use what you have.
Look, that's where I was coming from on my side today was the fact that a lot of the stuff that all the stuff that they have prepackaged and all this other stuff, we didn't have a lot of that stuff.
Definitely, definitely.
So we had to come up with whatever we could come up with.
What you come up with,
and try to get somebody to survive until we got back to the pod. So man, you just gotta improvise with what you got.
Yep. On the last one, I talked about how you can use your head wrap. You wrap your your do rag. You can make that into a bandage and you put pressure dressing on it, or a tourniquet, or this that, or so. Yeah.
This is what I will say about. This is what I will say about plugging a hole though. If you can use For us, as far as me and my partners go in law enforcement, we try to use either a pad or a tampon before we go to any kind of quick clot because they got to get that stuff out of there. You know what I'm saying? And that just makes the process a lot worse. So if you can get away with plugging somebody with a pad or a tampon before you go to the quick clot, that would help out that patient.
That's like the final,
Right, a lot more than just going straight to the quick clot because you know for sure it's a gunshot wound.
Yeah, right. And again, there's so much information out there on training. They have Stop the Bleed classes. They have so much stuff out there. Get out there and get that information, people, because what works for me or this, that, and the other. I'm not excited. So get that information. It's out there. It's needed. Carmen was talking about earlier. This stuff isn't a joke. There's people in New Orleans going through some mess now, and they're not prepared
at all.
So we need to get ready.
I'm expecting Katrina to come back twice.
Also, man, like I know a lot of people have their CPR training, but I don't know what it is. But I've walked on so many scenes where somebody might have been overdosing or something like that, and CPR is being performed, but they're still breathing and there's a pulse.
Yeah, so you got to check. Yeah, you got to know what to
when
do.
to give CPR. If you want to take CPR classes, know when to give CPR. Because just because somebody falls out doesn't mean you start pumping on their chest and trying to give them breathing.
You might end up killing them. Yeah,
exactly.
Hey, so what do y'all tell somebody like me, who I get real panicky in certain situations? I remember one time I seen one of my homies get shot, and it was just in the arm, and boy, I was jumping around like a fish because I didn't know what to do.
Yeah, and that's probably why you panicked, because you didn't know, you hadn't prepared. So the big thing is, once you prepare,
9 times out of 10, you wouldn't even panic, because you in your mind is gonna click in and be like, "Yo, I already know what to do with this. Let me go ahead and get it straight." You know,
that's the thing. Once you take a class or something like that, and you actually get the knowledge on how to do it, it takes a lot of that panic away, because the main thing you're panicking about is what's going to happen.
What's happening?
Or I don't know what I'm doing. Or I've never been in.
That's what I'm saying. You can't help. You don't have any way of stopping this or whatever. So once you get that training and you can say, okay, I can do this to at least help him go a little bit longer than he would go than if he wouldn't. You wouldn't be jumping around a fish. You'd jump into action to help your friend, because you know that's going to help him in the long run. You feel me?
So where can I go to get like what would you recommend? Not just me, but anybody, to go and get that information for somebody who don't know. Like if we said, man. Because, like, okay, for instance, when I did like the EDC bag, right, and I see a lot of stuff that I learned from MHP, Black Poindexter, Carbon, everybody, K Foss, that gives me the whole, like, man, you need this, you need that, you need that. But then I don't always know what to do with everything. Like, I was looking at some of the stuff like, what the hell is this? Why I need a parachute cord? I ain't got no parachute.
It goes back to going to get some training. You go get some training. It's classes out here, all kind of classes out here to train you.
Also, man, like I was listening to Black Poindexter on the way to the house, man, and he said it, man. There is no reason YouTube has all kinds of information on there. And there is no reason for anybody, like, you could have been looking in that bag and saw something that you didn't know what it was, and you can type it in the YouTube search, and it will
somebody already on a video class.
It's like 5-10 videos.
How to do it. You know what I'm saying? Just like Poindexter said, there's some stop the bleed classes. You can go and watch some videos on that before you actually get the training.
Exactly.
You know what I'm saying? Just sort of put you up on game when you get to the training. You know what to expect.
Exactly.
Mostly as us, and what RGG is saying, mostly as us as Black people, we prefer hands-on right there. We can watch movies, TV shows, reel to reel like we in school, until the situation hit. We that people that run in. Okay, take care of that. 9 times out of 10, when something happens like that, we back off.
Yeah.
So we have to break that. And that's what he's trying to ask, where can I go get that training? It's just like self-defense. You can watch self-defense and kung fu movies all day long. Somebody grab you, you don't have a clue what to do.
I'm pretty sure, I'm sorry, I don't mean to cut you off. I'm pretty sure any fire department could give you direction on where to go to get a stop the bleed course or something like that.
Yeah. Hospitals, our hospital gives them away for free. They every month they have a stop the bleed class, and they're trying to get people in there. So it's like the resources are there, and they're trying to make them available. So start with the hospitals.
Cloak and Dagger giving a stop and bleed class or something like that. Like ain't they doing one?
No, they didn't do one. They're doing a different version to it, because there's an update to what actual stop the bleed is doing right now. They're trying to upgrade a few things about it, but I think they're going to actually talk about it when they introduce their version of it. The class that they're going to be given for it. So look out for that.
If you want to know about it, Cloak and Dagger has been given. They've been giving classes for a minute.
Yeah.
So
100 kilos.
They mentioned the stop and bleed class that they were trying to do.
Yeah, so the information is there, RGG. Take a Saturday morning, and just every Saturday morning or once a month on a Saturday, go out and hit a class. Then you'll start feeling more comfortable. They're not long at all.
Yeah, the stop and bleed class isn't even that long. I think
it's like an hour and a half.
And you can go back and become an instructor.
Exactly, and that's the next step I was going to say. Once you learn, then you want to start teaching, because that reinforces your level of knowledge and this, that, and the other. Once you start being able to, give it back, you start getting to that next level.
Doing your own research on certain things.
Exactly.
And then you're gonna start seeing stuff like, oh damn, I can do this.
And it starts. So it's pretty fantastic. Once you start down there, it just feeds on itself. You just start trying to learn more and more. So just starting is the big thing. Just getting out there.
Shout out Lady Wick TV for checking in. What's up?
What up, lady?
I just want to go back to something that Diesel said. Diesel had mentioned the quick flood. That's the powder form, right?
Yeah.
A lot of times people don't like to use it because on a windy day, it'll blow it away before it gets to the actual artery or whatever it is that needs to be clotted. So it shouldn't be your first one, but if that's all you have, go for it. There's also the S-roll, which has a line that's embedded in it. So when the patient goes to the hospital and they put them on the X-ray, it actually highlights it so they know exactly where to go in and pull the gauze out before doing anything else.
I didn't know that.
Yeah, check into that one.
That's good to know because all this is first aid. You're trying to get that person to the point to where you can take them somewhere else. So everything you do has implications further down the line. So you don't want to do any additional harm, or make it more difficult for somebody back at the hospital, ED or surgery, to do what they need to do. So that's excellent, Carmen.
Thank you. Don't forget your CPR mask. Your health, the person's health. They have some. This is a training mask, so it has the face. It tells you exactly where everything goes on the person. You're on this side, and it's you're breathing out into them. Okay, so one-time use. This is just if you want to acclimate yourself to it, train your kids, whatever. You can get this on the Big A. That's where I got it from. Ampoule, I don't know if you'll be able to get that on your store, at your store, but that's a really good one. And if you can get I have so much stuff on my desk. It's the big red one. I can't find it. I don't even know where it is right now. But it's
the external mask.
The external mask.
I was looking for mine too. I can't find it.
I don't know what they did with it.
It's in my bag.
I have no idea where mine's at.
The AED it'll always disappear until you need it.
Yeah, no, it's a CPR mask, but it's
trip
the
over
big. I don't know where it was. I'll find it sooner or later.
Yeah, y'all go check out kfallsurvival.com for your needs. First aid and survival items.
Mm-hmm. A bandana is a very great. Yeah, that's it. There you go. You think it's nothing, but it does so much. From a broken hand to help secure it, to cleaning out water that you may have found, just to strain it, use it as a strainer, cool you off, cool somebody else off, wipe away excess stuff, cover your face, cover their face. Just for gray man purposes, I wouldn't get the yellow one, but at the end of the day,
don't get blue or red if you're in the wrong neighborhood.
and it's not one of them rags you keep by the bed. Now, don't keep them rags by the bed, fellas. Now,
no.
And get more than one. You tie them together to make them bigger.
Good Diesel, wow.
We're trying to ignore Diesel. Go get us in trouble.
Diesel, don't start, man.
I know. I'm not. I'm trying not to. I'm be good.
One important thing. Did you do trauma, the shears?
Yeah, that's in my kit, my toolkit. That's trauma kit.
Very great. So.
Man,
So
those
trauma
will
shears
do anything, bro.
Yeah.
I love those, man. I keep those on me at all times.
They also pants
They'll
cutters.
cut through a
Wait,
booty
what are
belt.
those? What are those? Q?
These are
trauma shears.
Trauma shears.
So if somebody has a shirt or anything on, or you've got to cut
Bro,
through
they'll
a
cut
seat
through a
belt,
patent
anything.
leather police officer's duty belt.
Yeah.
Very well.
So sometimes you got to get stuff off.
They're
Or,
up. I mean, they're what you need to get through something. You know what I'm saying?
This is going to get through it. And I don't know if you can see the tip of it where it's rounded so you don't further injure the individual that you're rendering help to.
Exactly.
Yo, K Falls, that's like the bag. Who won last night on the channel? Devil Roll? I think
this
it's like that though. That's how that EDC bag looked, like the one he got.
This is mine. I keep
it looked like
your
that.
channel, right? K-Falls. That's the Ampoule. That's right from your channel, right?
Yeah.
Okay. K-Falls Survival.
K-Falls Survival.
Don't forget to get eye patches or eye guard. If you come across somebody that has an injury to the eye, you want to secure whatever is left of the eye and prevent any type of infection from transportation back and forth, whatever. Eye patches, just try to keep some in.
I got splints and everything, man.
And never take anything out. If something's in the eye, leave it there.
Leave, you
Just
don't
cover it, protect it.
Right.
You know, even if you have to use like a cup, like a styrofoam cup or a plastic cup, putting over to protect it, you never want to take it out because you're going to do more trauma trying to get it out than help. So.
Now that's interesting. We should have told tactical
and
Skate
y'all
man
be
that
careful
last
trying
night.
to help these people too. y'all be careful helping these people, seriously speaking,
Oh,
because
man.
a lot of people get hurt trying to render aid to other people.
Yeah, and
So
that's the
just
thing.
be careful, man. I've
Be
seen,
careful.
I've had to witness a person, a civilian, pass away because they ran to a scene that had a chemical leak.
Yeah.
And they got,
Wow.
they got poisoned,
Good
and
to
they were
know.
trying to help, but they got poisoned and died right
Yeah.
there on the scene.
Yeah.
So just be careful, man. Y'all try to stay aware of your surroundings, what's actually going on, all those kind of things, because you don't want to put yourself become a
harm's
victim
way.
as well, or a
Exactly.
patient as well, just like the person
Exactly.
that you're trying to help.
And
So
that's
what
the
do you
big
do?
thing.
Like, okay, you just said like you don't take nothing out of the eye, whatever, right? You're not supposed to do that.
Right.
So what happens like if you get something in your eye, every time you blink, it hurt because you feel like it's in there. Like if you get a little piece of glass or something in your eye, whatever.
Don't mess with it.
Eye
You
closed.
gotta
You put the patch on.
put
You
a
keep
patch
the eye-
over and keep your eye closed.
Exactly.
So
Exactly.
keep it closed.
Yeah, you want to keep it.
That's
you wanna keep
where-
it closed.
Right. That's where your tape is going to come into handy.
Exactly.
Patch on or whatever gauze you have that's available, or the
And
eye
cover
guard,
that eye.
and cover it up. And,
Protect
until
it.
where they at it.
Yeah. And it
John
may be
Hardy, what up?
uncomfortable, but yeah.
'Cause the more you blink, the more you're going to move the glass in the eyes.
Exactly.
And what's funny
It's gonna scratch
is
your
that
cornea.
little bitty glass is the worst because
It is.
it'll slice you up every single time. It'll slice it, because that little bitty glass is so hard to get to.
Yeah.
And
Scratching your
also-
cornea every time. it
Also,
moves.
let the people know. Also, these items should be in your EDB bag, your everyday carry bag.
Yeah, I have everything that we talked about on the desk here. I
say
have in some
EDB?
form.
EDC.
So I have it in here. I have it in my EDC bag. I have it in my car bag. I have it in my big bag.
Mhm.
Yeah.
So,
See, my EDC first aid is a little bit different. The only thing that I really care about carrying, and everything that I carry, is Narcan and a tourniquet.
yeah,
Those
see,
are the
that
two things
Narcan,
I carry in and those shears I carry in every single medical bag I have. But when it comes to my EDC, I just have something for personal care and the people that are around me. I don't really have anything that, I have to run back to the car to get something for somebody else, because that bag right there is just for me and mine. You know what I'm saying? So, that's just how I do.
And that's where the personalization comes in. You have to do what's best for you, your family, your situation. So it's not just Black Pointer said this, somebody else said this, yada, yada, yada.
Right.
You have to build it for yourself and what you need and know, your circumstances. So it's very personal. So that's kind of the exciting part too. You can make it what you want it to be. So
Mhm.
I'd like to thank
There's
all
no
y'all
one
here
answer.
for Survival Saturday.
You're
We're
welcome.
gonna keep this going.
Yeah.
yes, sir.
Man, I'm sorry I was late, bro. I was,
No, it's all good. It's all good, man. Like I said, once you come in, we learn from everybody. So that you weren't late.
Man, you got me working on my off day, boy. You're all right with me. You're all right with me.
There you
Don't
go.
forget to put this. It's a battery charger.
There you
Oh
go.
yeah.
Yeah, I need one of those. Q, give me one of them for my birthday, could you?
Okay.
15 of them things, man. I keep them everywhere.
You can have this one is solar powered, so you can either plug it in or just leave it out,
Yeah.
just in case your car
Solar
breaks.
power. That's dope.
Yeah.
Yeah.
so-
What you do is when
Yeah.
unless
Sure,
it's
you get a
plugging
solar
out,
power one.
you just leave it outside of your bag and let the sun just grab it. And then when it's time to use it, you can just plug it up. Go.
Oh, and the other thing I have in my kit now, because thanks to Carbon, is my communication device. So that was something that I did not have in February. I have it now thanks to Carbon,
Okay,
working
yeah.
on that. So that's another thing that I put in that bag as well.
There's
Because-
one also.
Yeah, that one.
Uh-huh.
What is that?
It's a device that helps you charge your stuff
Solar
up
powered.
with the solar power.
Mhm.
Solar
Yeah.
power. It's 2 panels on that one.
Yeah. Put
I
in
like
the
that.
bag. In a little bag like I
So
carry.
the kind of training that we got as police was first aid, buddy aid. Have you heard about that?
Yes, sir. Yes, sir.
Yeah. So that's the kind of training we got. It's basically stop the bleed, but it's
Yeah.
more
A little
it's
bit
more of
We
a
didn't call it
self.
that in the military. We just called it battle buddy in the
Yeah.
military. So,
Well,
pretty
they
much.
called it that for the first year, and then they changed it to first aid buddy aid.
Oh,
So
okay,
I don't
okay.
know why, but it was the same thing.
Does
Hold on,
anybody-
y'all. I got a bad habit. I don't want to cut everybody off. I'm sorry, MHP, but this just in me. It bothers me. Can y'all hit the like button, please?
Okay.
Oh, please.
We just down a little
Well,
bit,
let me-
man. We got to get this thing moving,
There we go.
and it helps the channel a lot.
There we
Thank
go.
y'all so much.
Get it.
I'm telling y'all, man, the knowledge we getting from this is you can't find this anywhere. And I think it's cool. It's up close and personal. You got questions you can ask. This is dope. I know I don't know this stuff, so this is all great for me. Sorry about that, man. Y'all go ahead. Go ahead. I'm gonna shut up now.
Does anybody carry a flare gun?
I don't have one anymore. I need to get another one.
That's a good question. Also, if you don't carry a flare gun, you can get flare rounds for your shotgun.
Right.
Oh, really?
Oh, okay.
Yeah.
I just
I didn't know that.
Oh,
But
wait.
you have to gauge.
Okay.
The gun,
Well,
I want to show
there
it.
we go.
You could do it, but it opens up just like a revolver. You slide this in, and you shoot it off up, not towards anybody, up in the sky, so they can find you. If your car turned over, you're in a ditch, and you're not visible. This comes in handy. Make sure you have this.
Wow. Now, what would be the cost of something like that versus? Well, you're not gonna always have a 12 gauge next to you, but I guess you
No,
can keep
it's a
a
small revolver. I can't show. Well, let me see. I don't think you can see it. It's a revolver.
Oh, okay.
I can't show the gun on the thing, but it's just like
it's a single shot, kind of like a single shot, right?
This one has. It's a single shot. It comes with 5 cartridges. And you utilize it when you need it. Just say you're on the highway and it goes off the side of something, and then you're in a ditch where people are just driving by. They don't see you.
There we go.
That's dope.
You're gonna need. You get
Where
a little.
can we get that from? We can get that on.
They probably have it at Cabela's or
Amazon.
Amazon.
Walmart, I think, even got it.
Firearms.
I need to get that.
You can get it.
It will be on kfallsurvival.com.
Actually, they are on there, so you can go on there. And get
Okay.
it.
Oh, that's
There we
what's up.
go.
Okay.
There we go.
And then once you shoot this off, it's not gonna stay lit for long. So just make sure you have something that'll
Multiple.
let them know your location, but absolutely fine. You could turn this on. It sends out a bright light so they know exactly where to locate you if it's through the helicopter or whatever else. It's really bright. I don't want to turn it on because it's probably going to be like crazy, but
I have a survival radio that has that. It has a sound and it has a flashing light on it. The one that has the crank on it and everything. So it's always good to have. So yeah, if you're down in the ditch.
Right.
So I'm
Make sure y'all
definitely
looking
picking
at
up those
those
flares.
Tactical's comments too, because he's giving some good information out in the chat.
Yeah.
Yes. Seatbelt cutters and windshield breakers. That's what
I just pulled one of those out.
Yeah.
It
Batteries.
And a windshield breaker and
I got a whole bag. Don't know what half the stuff is.
Yeah.
Yeah, Carbon and I have the same one basically. So it's like in the windshield breaker.
I got that on my. You got to be kidding.
That's a windshield breaker on the top.
I can bust it.
Belt cutter right there.
Yeah.
Hold on, man. I'm trying to find my pocket. Wait a minute.
And they have them in different type
I can
knives.
buzz a window with this.
Yeah.
Yeah.
Yeah,
Oh,
right there.
a lot of them aren't these used like if you were to fall in the water or something like that, and you can't get
Yep.
out of your car and you just put,
Yep. We were talking about the New York situation with the flooding. People stuck in their car because of water pressure on the door. Now you go boom. So yeah.
It'll bust the windshield too. So
outta
you
Oh,
know,
definitely. Oh,
I'm
definitely
about to
does.
go bust a window right now. Just because I get
I
off
was just
this live, I'm
practicing.
gonna bust a
Please,
window.
please have your hand because I was just practicing.
yeah, I'm just practicing.
What's the right technique?
It's gonna be instead of the regular gun guy, it's gonna be the regular glass getter.
Have this one, you just put it right against the glass and you press into it and it
Oh, and it fires up.
and
That's
it
another good one.
You do what?
Carbon, do you have everything over there?
Pretty much.
Everything. Everything. I've never seen nothing like it.
Everything.
Boy, with bee sting the other day, I was convinced she
She
got
got me buying flares. She got me buying,
Well, she got
yeah.
That's the bee sting kit.
I didn't even know water came in packages. Carbon
Yeah,
coated.
package water. I saw that. I was like, dang, I'm slipping. I'm
Oh,
slipping.
where is it to have everywhere you go?
Everywhere you go.
Wait, Q, go back to the what was the thing that you pressed against the window? What was that again?
Oh, it's the seatbelt cutter is on. I'm sorry, seatbelt cutters on this side.
Yeah.
And then if you want to break the window, you just put it straight to the window and then you press in. It shoots out the metal piece right here and it shatters the glass.
It's like it has a spring on it.
It's got a spring in it.
Yeah, spring loaded.
This black part pushes in.
Wow.
Right.
Y'all
There you
keep
go.
fire starters in your first aid kits?
Yes, I have a fire starter kit, definitely.
Okay, so now here I go again because I know it'd be sound like I'd be repetitive or asking a dumb question, but with the EDC bag versus having, because a lot of this I hear is like first aid if there was a traumatic situation that happens, I get it, because a lot of this stuff I never heard of. So, but there's a complete difference between having a regular, your everyday carry bag, right? That's what you were saying, Diesel?
Well, okay, so you're right, but I carry my first aid. I carry a little patch first aid. That's why I say I only have what I have from me and mine's in my EDC bag, because I don't carry all that stuff. I have all that stuff in a separate bag, so then I have to run back to the car for it. But my EDC bag has a little first aid kit that I keep everything for me and mine, for me and my girls. You know, if we were to go out somewhere to happen or something like that, that's what I keep that.
And that just kind of stays on you all the time.
That stays in my EDC bag. Wherever my EDC bag goes, now I can't say I take my EDC bag everywhere I go, but most places that I go, I have my EDC bag on me, close to me, somewhere like that. And that's where I have that kit.
Yeah. And I have my EDC bag that has its own supplies. I have this inside there. So this, I can break this down. Say I have to get mobile. I don't feel like carrying another bag. I could put this on a belt, yada, yada, yada. Right. I have everything that I need. Then I have my big bag, I have my car. So it depends on what the need is. If I need to be mobile but move quickly, I'm just going to take this, boom, and I'm gone. So yeah.
So do you guys? I'm sorry, man.
Go ahead.
Do you guys, including Carbon, when you leave out the crib every day, is there a bag that stays in your car, or is there a bag that just kind of stays by the door?
I have a car bag that has certain kind of things in there.
That never comes out the car.
Never comes out the car.
I take it out because some
well, the heat, yeah, certain heat, yeah.
The heat or the cold, so you have to kind of.
I don't drive my car that much. That's why I don't keep my bag in my car. If I know I'm gonna be in my car for a little while, extended amount of time,
that's a nice bag right there.
I'll keep something like that in my car.
Yeah,
but
that's a nice bag.
I have an EDC bag. That's why I keep my EDC bag, because when I do go to my transition to my car, I have my EDC bag to where I don't have to load up every time I get into my car. I just have my it's in my EDC
already
bag.
in there.
So you walk out. So that it's like I keep it by the door.
Yeah, it's like
I grab my wallet.
Yeah, it's like a book bag. It's like going to school, man. I keep it.
Yeah.
And it's not
It
even
goes
a
in my
big
car.
bag.
If I go to Walmart, I ain't bringing it into Walmart with me, nothing like that. You know what I'm saying?
I understand what you're saying.
But I keep it goes with me pretty much everywhere I go.
Yeah. It's one of those get home bags.
Yeah.
Yeah, there you go.
Perfect. That's
There you go.
That's what it is.
Yeah, you can put that in your EDC bag. You know what I'm saying?
Look,
In your
yours
EDC
and
bag,
Exactly.
you have a
about the
first aid
same
kit.
size, bro.
Exactly. Same
Yeah,
thing.
that's about how size, and it's got Molly on it. See, that's what
Yeah, so you
Poindexter
can
was
have Molly
saying.
webbing.
That Molly part you can put on a vest. You can put an exterior.
You said it got
vest,
Molly in it.
No.
I forgot.
What I need Molly for?
Hold on. It has the attachments.
It's called a
the
Molly
carry.
attachment. It's these little straps.
Yeah.
Right here.
So you can put that
That's
on
how
a
this
carrier
goes.
vest. You can-
I was like, I'm not carrying that. Y'all ain't finna set me up. Carrying no Molly.
Oh yeah, he
Yeah,
got everything.
wherever Carbon Q live at, that's where we moving to.
When
And then we know we good.
needs to go. He's got a lot of stuff. That's my everyday. It's a little bit different.
Oh, nice.
She got a hard kit. That's a fancy EDC bag.
When it's hard on this side.
Oh, yeah. That's
I like that one too.
Who got
There
this?
you go.
Yeah.
Yeah, if you got that, y'all look at you old fancy people.
KFrostMama.com.
Yeah. I don't know if anybody seen one of these before. Y'all ever seen one of these before?
I don't know what
Yeah,
that is.
yeah,
It's
so
in this
it's-
bag. What is that?
It's a bracelet, right? It's a bracelet that you can put on your wrist. But when you put it on your wrist, it's actually got a compass on it. It's got
There
a
you
whistle on it.
Same here.
That's a whistle. People don't even know that's a whistle.
There you
Wait a
go.
minute. That's cold, boy.
But see, a whistle comes in handy though, bro. A whistle comes in handy.
Boy, wait till I show my cousin this.
It's a little knife on the end. It's a little
There you
knife.
go.
Bracelet
I like
with a
that.
whistle.
I like that.
So if you need to cut tape or something like that,
There you go.
use it to cut the
Does
tape.
everybody know when you would need to use a whistle?
If you're out, like the
Damn,
carbon's
whistle
in
don't
a
work, man. Let me
ditch
tell y'all a
off the
ditch
side of a
Very
road.
far. You know what I'm
If you're
saying?
able
You
to
can't
move,
see. It's
yeah,
far from like to get
can't
out.
see.
Yeah,
Yeah.
you can't see.
Or
Smoke.
you-
Or you
It's
lost
outside,
somebody
you
else,
know?
One time-
you get in contact with them some kind of way.
Right.
Yeah.
This was some years ago. I was in Florida with my kids.
Mhm.
We got on a jet ski.
Mm-mm.
And people told me, they gave me a little quick 5-minute training course, gave me a life jacket. It was me and two of my sons. We got out there on the jet ski. It was a boat came by and the wave hit us. The jet ski flipped over. As you all probably have noticed since I've been on YouTube, I'm a tad bit overweight. You have to climb on the back of the jet ski and imagine trying to pull myself up 250 plus pounds trying to get up on the jet ski. I was struggling. My son had me around the neck. He was screaming, "Daddy, don't let me die." The people that gave me the whistle, I blew the hell out the whistle. Whistle loud enough. Nobody ever came to save me because of the whistle, man. It was my adrenaline. I cut my foot trying to climb back on the jet ski. This is a real true story. I'm not lying to y'all. It took everything in my power, man. And my son holding on to me. You know, that's how I know that love for your kids is something real. Because prior to that, I was having trouble pulling my fat self up. But then but my son was screaming, right? It gave me that adrenaline. I was like, whoo, I got back on there, saved everybody. I'm here to talk to y'all and tell you the story today. But damn them whistles, man. I'm not blowing no more. That's my story, and I'm sticking to it.
Damn that whistle, man.
Oh, man.
That's another thing.
I like the fact of having a whistle, but it don't work.
Right.
Did you get you told them the striker on it?
Yeah, I got mine. I got the striker on mine.
Oh, and everybody asked about that paracord.
Oh,
223 DMR said something about paracord. And I carry 2 bundles of paracord at all times in my bag.
What's funny
bag.
is
it's not in my medical bag, but
you
I
can
carry it in
actually
my
use
EDC
this.
bag.
I keep it multiple.
Unravel this.
Yeah, that's paracord bracelet. Yes, paracord bracelet.
Okay.
Oh, really? Okay.
And then for the cord, it should have like 5 different strands: 1 copper, 1 fishing wire, 3 for lighting a fire, kindling, and I forgot what.
Regular gun guy, look up the YouTube video on that paracord bracelet. It'll show you.
Now what does the actual paracord do? Like the paracord itself?
You can use it for rappelling down a side of a mountain or something like that. Like if you're it's extreme kind of situations, but you can use it for all kinds of different tying stuff off, for tents. If you need to build a tent or something like that, it's just for all kinds of different use.
Yeah.
Okay, make sure people know there's different weights for different cords, like 550, 1,000.
Like this is 1,500-pound paracord right here. I keep that, and then I keep some lighter paracord, depending on the situation. So, like you said, do your homework and get what you need. But there's all kinds of stuff out there, man.
I just found out something new, that this is a striker on here too. I didn't realize that.
Okay.
So the same thing is this. The same thing as this is a striker to make fire. There's one on here too, on this little thing. You see that?
You just right.
That's a striker in the middle.
Use that metal part on the other end and strike it.
Where's the camera? Over there.
And your knives, a lot of your knives have areas that are built for strikers as well.
So that's why you carry matches.
No, you don't need matches if you got this.
Yeah, you have that ferrous rod.
You gotta have this rod, and you gotta have something.
Scrape it on there, and it'll make sparks, so you can help.
I carry this.
Fire.
That's
my everyday bag.
I have that as well too.
I got that same thing.
Waterproof. Yep.
Take this off, and it's matches.
Yeah. And you can dip them in fingernail polish too. If you have a quick fix, have a fingernail polish.
Good one, yeah.
Damn.
I got some of them too.
Go ahead, strike a fire without a match. Go ahead.
I would need something.
I'm messing with you, man. Don't strike the fire. He was finna do it too. I'll show you.
I ain't got nothing
Gotta explain my way. RGG told me.
Right. Black Point, you said you had a flashlight that crank, right?
Yeah.
Does it look like this?
No, it's bigger. It has the radio. It has the rapid communication. It has the sound. It has the NOAA frequency. It has multiple. It has a solar panel.
Deep stuff, man. Hey, $2 said my big ass won't make it down that mountain. Me either.
Hold on one second.
I don't know how I'm gonna get down that mountain, man.
Surprise, man. That paracord is some strong paracord.
It is.
Like, it is strong.
It's strong as hell.
I'm telling you, man. You'll feel a lot secure, like going if you know how to tie your knots and all that stuff. You got to know the training, but as long as you know what you're doing, man, you'll feel real secure going down the side of the mountain or something like that.
Yep.
Now, I ain't never tried it.
Me neither.
Yeah, you're gonna get a lot of speed if you just roll free when you're big as me, boy.
Oh yeah. You got the real.
Damn, that's a flashlight.
Nice.
That's a concert light. You get a radio station.
Demon set up real quick.
I'm about to say, RGG about to start running, boy. You better stop.
Yeah, I heard that. Sorry, I'll finna get up out of here.
So yeah, it's good.
Wow.
Hey, y'all got some stuff, man. I gotta really. I'm sitting up here with a damn bag, don't know what half the stuff is.
Yeah,
that's where we got survival.
I'll be done set myself on fire because I didn't know that thing striker. I'll be here playing with it, blew up stuff.
it ain't gonna set your stuff on fire. You gotta have an ignite. You have to have something to ignite it too.
You gotta
you can't just. You can strike it, but it's just gonna be some sparks. You have to have something like some
kindling and everything else.
Covered cotton balls or something like that, and it will help ignite it.
And these lightning bugs you can get from REA or Walmart.
Mm-hmm.
Right.
In the campus section.
Look, Carbon gave me one of these right here, just in case you want to, you need to bug in or something and you ain't got no lights. So it's a light. Just open that thing up. It's solar powered.
Yeah.
Just turn them on.
And that's gonna be on your website.
I see that, Ramsey J. I see what you said.
I think so.
This one has one of those as well. Solar power, battery power, crank power. So you can has a lithium ion battery. You can charge it up.
And holds up.
Has a USB connection, so you can recharge your phone. So it works pretty. We tested it out during the
So I asked a question. I bet some people are asking.
Okay.
So for people that don't have any of this stuff, none of this survival stuff, none of this stuff that can help save you, what is a realistic amount of money to spend to get going, to just get your first setup? So
KFOSsurvival.com.
I got that part, but at least we tell them so they know where to go.
You can probably get this right here on my website, probably for about at the most like $65, if that.
Yeah, that's not bad. That's
with everything. That's with everything you see in it.
Yeah.
So I think excluding the knife. Other than that, I think everything else is in it.
So we should be looking into a bag like this for a bag like this to get started, right? So we could tell everybody safely, if you just put $100 aside, have something to save your life.
You could do good for $100.
$100 would be good. Actually, you would get a bag like MHP's bag for $100 with everything in it.
You can get you a nice little
knife.
The
starter kits don't have majority of them don't start with the quick clot and all that stuff.
Right.
They just do your generic.
They don't have that.
They don't have the tourniquets in it, none of that stuff. They just do your generic first aid stuff that you need. Like they won't have the Narcan, they won't have the quick clot, and they won't have the tourniquet. So if you were to have $100, you would have $40 to get all that other stuff, which is more than enough money to get all the other stuff. A tourniquet like $20. And just like Poindexter said earlier, make sure you get a good reputable company.
This is $200.
That's the Amamance man right there. That's $200.
I think $220 has everything you need plus more oxygen cannulas, everything else in there. It has. So this is a good deal.
I ain't even got that in my police car.
So
yeah, the ambulance ain't got all that.
Mine is a whole knapsack. I'm not gonna get it.
Yeah.
And I just put down the website down here in the link with the chat.
This was about $100, right?
See, that's excellent right there. I like that.
Yeah,
and this one, I got pretty much everything here the same way as that one.
And I'm gonna put up on my IG what's in my EDC because I'm gonna show you.
Oh yeah, there you go.
Shop that what I have weapons wise in there.
Hold up, these are. I don't know if you see these. These are real. They come in handy. The little D rings.
There you go. Yep.
Right. I got those on every keychain I have.
Yep.
I got a D ring on every keychain.
I don't want one.
Urban Gun Review says there are different size
tourniquets, but I keep it some blue white on me. Just in case.
Oh Lord.
Yeah. Look,
I don't want no D-ring, man.
Not that kind of, not that one right there.
You know what? You gotta have them.
That's pretty much in this bag, in that bag right there. I got it in here in this big bag. The only good thing about this one is I actually got meals. I got meals in this one.
Yeah. I got my MREs.
Mm-hmm.
So
the one thing we should do, since we are at a moratorium starting Monday, that month we should spend or have people spend that on their, EDC bag, their first aid. Since we can't buy guns, spend that month.
At least
go ahead
get
and
that. You know what I'm saying?
Who can't buy guns? Why can't y'all buy guns?
We can't buy guns starting Monday.
Who said that?
RGG. He said we had to stop. He said we had to
go.
Hey,
cold turkey. I was going to talk to you about that tomorrow. I didn't want nobody to break the news to you like that. I knew you wasn't going to take it.
I'm sorry, RGG. I'm sorry.
Ammo, man. I rebuke the devil is
30-day drought, man. You can do it, bro. You can do it.
Tell me why we can't buy guns?
Diesel.
Because we addicts.
There's some addiction going on, man.
We need to kind of wean
I'm
off.
I'm good with my addiction.
You're not good.
I'm a functioning addict.
You're not good, man.
I hope you got a Narcan.
He's already shaking.
I
got to say goodbye to my grandson.
Hey, it's taking weight off of me. I'm good with my addiction. I'm good. I'm gonna keep on.
Hey.
There we go.
Hey,
There we go. What's up?
look, say hi.
What's up? Hey.
Yeah.
Can we get ammo?
Hey.
Say what's up, y'all.
We can get ammo.
Hi.
Yeah, we can get ammo.
Hi, people.
What's up? How you doing?
Hey, man.
Bunch of ammo.
This is my only grandson, y'all. Rest
Yep. I got one too. Just one.
Yeah.
There you
You
go.
want that?
Precious.
Say hi to everybody. Say hi.
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 No, don't say hi.
He's like, nah.
No, he getting ready to go home. So my son brought that. All right, man. Okay. Bye. Love you. Mwah.
There you go.
So Monday, what's happening? What's happening Monday?
Nothing. Ain't nothing happening Monday. Don't worry about it.
Hey, Diesel, man, my bad, bro. Listen, they weren't supposed to. Black Point.
I'm sorry. I let the cat out the bag, man.
Hey, read the
I was
comment
gonna-
what Smitty
I'm
said.
sorry.
Hey, okay,
Look, I was told by Carbon to keep duct tape in here too.
Yep. We gotta have it.
We
Always.
Hey, to be honest with you, this would be good to stop a cut too. To be
Yeah.
honest with you, you can wrap
That gorilla tape.
I keep cutting duct tape for
If
everything.
you from the country, you done seen somebody
Everything.
use
know,
some duct tape
where
on a
they
daggone
look,
big
you
old
see
cut.
people ride around with their cars duct tape. You know,
Yep.
they
So
stay.
if it'll hold the car, yeah. If it'll fix the
Yeah,
car,
you're right,
it'll
you're
fix
right about
everything. So
You're
yeah.
supposed to get to write stuff on it, like if you gave them something and you had to, whatever, they on their way to
Wow.
hospital.
with a Sharpie.
Something is better than
Right,
nothing. I'm
right,
gonna
Y'all
tell you that.
got these. You got to keep these on you.
Yeah, those are
Yeah.
These,
Chem
these
lights.
when you need to
Chem
find your
lights.
way back somewhere and you in the dark.
There you
All
go.
them glow stick things.
Glow sticks.
Yeah.
Yeah.
I
Glow
need to get me
sticks.
some. I
This
never
is
thought
a,
about that. That's a good idea.
Did anybody show this? This is a whole shovel and pick and
Oh, I got
axe and
that,
everything.
Do not have a
What the
shovel.
hell?
There you go.
Yeah, I got me one of those.
Boy, I need one of them.
So it's a pick.
I'm going to K-Falls Tactical. I'm getting me one of them. Now that I need.
They on there too.
they on there. Yeah.
There you
They
go.
on there.
I'll be getting one.
Hey, you see this transformer shovel he got?
Look. Turn to a shovel.
I got that.
Big. And it's got some ridges on it, so if you need to cut down like
No,
A small
you
tree.
need a- Ooh, you can use that for anything.
Make sure you got your flashlight to check, your surroundings and everything like that.
bro.
Y'all pulling out all type of stuff. Just them
I
MacGyver
know. Right?
stuff.
I feel like I ain't come prepared with nothing. My
They
stuff
pulling out
upstairs.
all
I ain't
types
trying
of
to go
stuff.
upstairs
Like,
and get
none
my
of this
stuff.
stuff.
Shoot.
And it fold up. You see how it fold up? And it come with a little bag.
He got a whole shovel, but it go like this big. That's hard right there. Hey, what that shovel go for, man? Let me see. I put it on layaway.
I might hook you
You
up.
just get the handle.
Hey, Falls look like you got too much family. I can't trust it.
The handle first, and then we'll put the rest of it.
Too much
together.
family, bro. You can't trust it, bro. You too much family.
This is terrible.
What's this? This is a water filter,
Oh,
a
that
little
was
mini
dope,
water filtration.
Now,
Always.
yeah, I got that. That's that. Is that
Life straw.
Yeah, the life. No, this one
the
is
filter, right?
sour
Yeah.
or something like that, or Sawyer.
Yeah, I got. See, look at that.
Mhm.
I'm on some of this stuff.
Yeah.
It's
I
just a
got that.
process. It's a process, and you continually, getting stuff, adding stuff to it, modifying, changing. So yeah.
You have the saw?
Huh?
You have
He
the
said-
saw?
He said,
I have
"Damn, we got a
the
shovel."
wire saw.
Life straw.
Fire saw, yeah, I got one. Yeah.
Yeah, the life straw. Them life straws kind of expensive too.
The saw that like cuts.
Cuts down trees. Yeah, I have a ring wire saw.
I got the same thing.
Also comes in handy for other purposes.
You cut down a whole damn tree.
Y'all
Yeah.
see this?
Sometimes you
Yeah.
might have
Y'all see this?
Uh-oh, what that is?
So it's a mini fire pit.
There you go.
So all you gotta do is put a little wood in there,
Stuff in there, and boom.
and you can adjust it. Like if you want to put your coffee on top of it, have a little canister on top that's fireproof.
Yeah.
Put a little fire in there and go to work.
There you go. Don't leave any signs behind. Don't leave any.
And then when it's
on the
done,
ground.
clean it up, fold it up, and
Take it with you, so people can't track you as well.
yep.
What?
Yeah, you don't want to leave signs behind. You don't want to leave, because people can read fires. We heard it with the fire and stuff like that. Even when you try to cover it up, you can tell when somebody's been in an area.
Oh yeah.
And if you got a decent bag, like you said, make sure you got some cat litter.
I found these on. I think I got these on my website, but I found these on somebody else's website, and I ordered like 4 of them. They were on like.
And that's the thing. That's the thing too. There's a saying: 2 is 1 and 1 is none. Always have at least 2 of everything that you have.
Mhm.
So
And if your family have more than that, at least
And that's with me. Like I'm a primary first aid giver, so I have to, make sure friends, family, everybody else. So
I went to this is a fire starter too.
Right.
Believe it or not.
Boy, y'all five-star mother.
You need it. You're gonna need it.
The end of the world comes. Who's going to be in charge? The person who can make some fire, who can cook. If you can't make fire,
First thing, fire and that damn water.
fire, shelter,
Fire and water.
water. No, you
Find
run.
somebody that know how to cook shit.
Woo,
See,
that's nice.
see, barbecue. I don't.
Barbie be pulling out some.
Right here.
Barbie ready
Now,
to
look,
scout
look.
folks.
Listen, I saw her get mad one day on the live.
Yo, I saw that.
And then she's
Oh.
spitting out hatches. I
Do
do
you?
not mess with Carbon. Carbon, you are so beautiful.
Now y'all know as nice as Carbon is, that's the moment we all remember.
Yeah.
That was whoa. And I'm thinking myself like I'm some incredible host. I'm trying to Carbon, everything's good. Nothing was working. She was in a deep stare, like
Yeah. Like he was there, right?
it was terrible. Carbon, what the hell?
Oh my god. That's a nice
You got a saw
yeah, a nice saw.
or somebody out of a car, or you need firewood.
There you go.
Who's that?
Well, everybody that was attracted to Carbon Q, all that just went away.
You be well protected. Don't worry
We
about
just
it.
scared the hell out of everybody. Well,
Like, I ain't messing with no Carbon.
she is all the way down.
Your tactical knife.
There you go.
No, that's
You got
I
it.
keep
That's a
me
nice
a
knife.
straight knife.
I keep one too.
I keep a straight
Yeah,
knife.
fixed blade knife. You gotta have a
Oh,
fixed blade.
Again,
Put it in and turn it.
Yeah, I still got all my stuff in
That's
here.
in my kit. Yeah.
Put it
Gotta
in
have
and
fixed
turn it.
blade.
Did you say put it in and turn it?
That's
That's how
exactly
you-
what she just said.
Increase the size of the
She ain't talking
wound.
about
Increase the
nothing you gonna
bleed.
sell on Pornhub. She talking about what the knife gonna do now.
Yep. Increase the size of the bleed. Increase the damage.
I ain't gonna lie, there's been several suspect comments made on this chat tonight. I've been just listening like y'all are
You
some
shake your head every
He
time.
was
You
talking
put your
about
head
the
down.
D-ring
We learned.
And for females, you definitely have to, like, when you're using
Look
a
what
knife,
Ramsey J said.
you gotta look at the man or whoever it is. If they're muscular, you have to put some weight behind that.
The
So
damage. Yeah.
you put it in there. Don't just pull it out. Turn it.
Yep.
Make
Yep.
them work for that.
Increase the
And
wound
put
cavity.
Look at him. He was like,
right? And make them work for it. That's what
Yeah.
you
Your brother like a door.
Make him work for it.
you gonna work with this.
She'll never date again.
Where you from again, Carmen? You say you're in Pennsylvania, right?
She'll never date again, y'all. I'm scared. She's just my homie. I don't know what to do.
It's all good. We got to. You got to be like that.
Yeah.
I'm glad you're on my team, Q.
100%
It's
facts.
survival Saturday.
I got a little kid too.
You know how you have a problem, you call your goons up. I'm calling Carbon Q.
Damn right. Barbecue and Miss K.
Got it. Yeah,
That's right.
right.
I'm on
Barbecue
their
and Miss K
team.
is over with.
I want to be on their
Barbecue and
team.
Miss K. Hey,
100%.
we gonna make up our own gang sounds. Barbecue and Miss K.
Hey, throw that K in that Q.
QK gang.
So this right here came with this. Okay? This kid right here came with a real compass in it.
Oh wow, that's nice.
Yeah.
That's nice info.
Yeah, I
And
have a
that's on your
compass on
channel
there.
too, right?
And then I have one of my things. So
Came
yeah.
with a little
Multi-tool is
multi-tool as well.
Yeah.
Y'all
Always.
go out there
That's
and
what I
check
was
out
gonna ask y'all.
his
Do y'all have two? Do
Check
y'all
out
have
his website.
actual bags with tools
It
in
came
it?
with a flashlight on the multi-tool.
I have that separate. That's in my car back. That's all my tools. Those separate tools are in my car.
Hey,
and I have a
Andrew,
multi-tool in my
can you show
EDC
some
bag.
of the items that you have on your website.
I don't have a lot of them here, so
Okay.
a lot of
Wait,
stuff
wait.
is drop shipping. So, but I mean, the stuff I am showing you is the stuff that I did get from the website.
Okay.
So what I'm
Cool.
showing you
I
now,
was finna say. So you telling me all this stuff
Yeah,
you
a
show
lot of
ain't got nothing to do with the website?
There's a lot of
This
stuff
stuff you
on
got.
there.
I'm about to say you're a bad businessman, boy.
Man.
No. It's a lot of
No,
stuff
no,
on
he
there. So a lot
showed
of
you
stuff
what
I
he
don't
had.
have. Yeah, a lot of stuff I don't have. So, but it's the stuff that I'm showing you is what I've gotten off the website.
You have knives and stuff on there? Knives?
Yeah, it's like
Yeah.
matter of fact, that one knife I just showed you, the one I showed you that had the black one. That one.
Yeah.
From there, yeah.
Okay, cool.
Yeah, man.
I'm going back to rewatch this because I didn't see some stuff.
If you get a flashlight, try to get one with the ridges on the
On the
end.
Yeah,
There's a tactical
definitely.
flashlight. So now you can turn around, use it as a blunt.
as
That's a weapon. That's an excellent weapon. So you can.
It is,
boom.
exactly.
Yeah.
both
Yeah,
sides.
outside.
Definitely.
Where you get that?
A little gouging action.
Thanks, Carmen.
I don't know.
We
Carotid
appreciate you.
artery. Carotid artery. Just
Gotta
gouge it
make
all
sure,
around.
right?
There
Gotta
you
make
go.
sure that
A
everybody.
mini crowbar.
Oh
There you
yeah,
go.
that's a good. That's a good item
Oh,
too.
damn.
Mine is
That's
over
the
there.
thing. Yeah, you got to have, because getting, like she said, getting in a vehicle, opening
Yeah,
the
then
door if you're
somebody-
stuck in a
like,
building.
let's say it's an abandoned house and it's locked. You can't get
Yep,
in. This
can't
right
get
here,
in.
be able to get this
Exactly.
Oh,
out.
y'all gonna teach us how to break in houses too, huh?
We're gonna have to.
Survival
Some gonna have
Saturday.
to. Yeah, man.
It's Survival
Go
Saturday.
ahead, Diesel. Go and show us how to start a car without the keys.
RGG.
I'm
It's
just scared.
Survival
I'm scared
Saturday.
Homeland Security gonna come knocking at my door now. With everybody.
Make sure you have a change of clothes. Make sure you have some good boots. Make sure you have a blanket inside
Yes.
there. You have a hat,
Yeah.
a jacket. Just make sure that you have those things inside your car or somewhere in your
They-
kit. You can get one because
They
you never
make this
know.
thing called a frog suit.
Yeah.
It is an outer shell of a. It's like a rain protection suit, and it goes over your clothes. Man, it's like $30 for it on, and it's. I mean, it works great. That's what I use when I do my, because when we shoot firearms, we do it rain, sleet, snow, shine, whatever. We go out there. So when it's raining, we use that, and I come back dry as heck because I
There you
got
go.
the frog suit on. So
They got that
y'all want to
down.
look into it like a frog suit or something like that. They work pretty good.
Got it down.
They get it.
Thank
Yeah.
you, sir.
Hey man, I need one of these nights on my live where y'all come in and show all this cool stuff.
This is a sleeping bag.
Hey, it's only on Survival Saturday.
Right?
Only on Survival Saturday.
Hey.
There you go.
I'll be off on Saturdays, man. I need it on one of my work days.
And New York again reminded me flotation devices. If you have people who can't swim, you
Right.
got to have some kind of way. So at least if you're trapped in the building in a basement, you can at least float above the level of the water. So that's also important. But better to learn how to swim, but you can't tread water for 8, 9, 10
And
hours.
cool,
Most people can't.
commercial.
Yeah, and I tell anybody, make sure you get you a nice pair of pants, like 511s. That,
Yeah.
waterproof.
Dry.
You rinse them out, dry. Yeah, they keep you. They can, you can blow
Socks
in them.
too.
Go and
You need
see.
to find some.
Yeah, anything water wicking.
Yeah, water wicking socks
Yeah.
would definitely be a.
Licks the water.
At the end of the day, your feet need to be the first thing that you take care
Yeah,
of.
Gotta
right.
take care of your feet, man.
Those socks.
You're
those
raggedy,
socks are
you
the
might as
best.
well. You gonna sit where you
Can't
at.
do-
You know,
can't do
I can see
nothing.
some
Bad toes out there, boy.
Yeah.
If your dogs are bad, they gonna bark.
I see some bad ones out there, boy.
He said, "Ed Pooh doing a commercial."
Hey, man, I said
Hey,
so.
go for it.
It
Go
do
for
look
it.
like a
Go
whole
for it.
commercial. I just started watching you. I'm like, look, he gonna pull out something else. What do you got next?
Hey,
I got a whole
check the
box.
It's
website.
so good
He-
stuff.
He
Forget
like the
about it.
survival QVC.
There you go.
This is a bug jacket, so they keep bugs and bees
Yeah.
and shit off you.
It is. Mosquito scurry disease,
Mosquitoes and all
things
that
like that.
That's on the
Yeah.
website.
Like how it's good to have.
Bugs, this right here, you put this on and you won't get stung or bit.
That's on the
Ebola.
website.
Okay.
But there's tons of hookah.
Morning.
Unbelievable.
Harper showed me these right here. These are tablets to filter your water.
Water, yeah.
Well, if I had $1 every time he said carbon
What's the
show
shelf
me.
like? I've been
It's a
thinking
lot
about
of
Carbon
stuff,
bees.
a lot of the stuff that I'm showing
Carbon
you
is
stuff that
man.
she's showing me.
No, I know. I get it.
Yeah.
She the stuff she done pulled out today.
Yeah, it's
this is
like
terrible.
It's a
What's the
lot
shelf
of
life?
stuff.
Terribly
tablets,
entertaining and
Harper?
educational.
Do you have the Faraday bags nearby? I don't feel like going
The
upstairs.
Faraday bags.
I do.
Those are good for your electronics, especially if
Yeah,
you're gonna have your
that's true.
your chargers.
Yeah.
Faraday
You're
bags.
gonna need
Faraday bags. Governor Hooker, what up?
So the Faraday bags, they look like little bags. They like aluminum foil.
Mhm.
So what they do is you
Oh,
put all
yeah,
your
I got
devices
some.
in them, and it keeps them safe from
EMPs.
PMPs, yeah, and all kinds of stuff. So you'll be able to use them.
If you get like a radio burst, like from a solar flare or something like that, they can wipe out all those electronic
Harper, I got
devices,
me
make
2
them
of those.
useless. So it prevents damage to those electronic devices.
This right here is a towel, believe it or not.
Towel,
full-size
water bag, mhm.
A
What?
towel?
A towel.
A
Mhm.
towel
What
set.
kind of towel is that?
If you're out, if you're bugging
Hey,
out,
listen.
You just have a quick something you could throw in your back.
Mhm.
dries and it wipes up everything.
There you
This is
go.
the Faraday bag right here.
Yeah.
Yep, that's
Yeah,
one.
Electronic devices.
right.
Yeah.
Especially if you're
Your data.
you're charging stuff right. Exactly.
Carbon, what the hell is that in
Power
front of you?
chargers.
It's a battery,
Backup battery.
right? You can jump the
Carbon,
cord,
man. You got
charge your phone.
everything.
But what if you your kids or somebody has that machine where they can't breathe?
Yeah.
You need to
The
plug it
CPAP
in.
machine. Yeah.
You're stuck someplace. This is good to have. You just plug it in here,
Yeah.
and they're good to go. So if you can, you should have it.
A lot of
I got two
people
of
have
those
to have
actually. I got two of
those.
the big
If you have
ones.
sleep apnea, you have to have those. That's a medical issue if you don't have those things.
Yeah.
And they
Anything
stay
that
charged without charging them. They stay charged for a while.
Wow.
So they don't use them.
And like imagine in Louisiana. I'm sorry, not Louisiana. Is it Louisiana?
Yeah, Louisiana.
All the
All
people
those
that come
people.
there, right? They have like a senior citizens home, 800
Oh
people,
yeah, that was crazy.
and they're all moved to a place. There's no AC, there's no heat. They're sleeping on mattresses on
Yeah.
the floor,
Yeah.
and these are older people, so they have ailments.
Yeah,
I'm
they're
about to
not
go
gonna
get me
last
a
long. They're
generator
not
right
gonna
now.
last long in that
Oh,
I
environment
don't have a
at all.
generator.
Okay, I got to let somebody go. Guns.
Okay, I'm gonna jump up real quick.
I can jump off
I
too.
get out.
can
I
jump
gotta
off.
go eat. I gotta stay fat. Listen, I'm gonna go. I'm gonna get up out of here, man. It's all love, brother. You got me here on my off day. You know how much respect I got for you. Keep it up.
Okay.
Diesel TV. I'll see you tomorrow. So everybody here, I got Diesel
Tomorrow
on
at 11 o'clock,
We'll see
right?
you tomorrow. Archie.
What time?
7.
11 o'clock. Oh,
No, 7, not 11. 7.
All right.
7 Central. I got Diesel TV, my boy. We're gonna chop it up, have some fun. We're gonna
Country.
do it the right way. So listen, hey man, all love to all of y'all, man. And Pooh Carbon, thank y'all. Black Point Dexter, you know what it is. I'll see y'all next
be
time.
good, bro.
Okay.
Hey, bro.
Peace.
Hey.
All right.
Oh, girl dads.
Yo,
Mills. Hi. Hi, Country.
Hey,
what's up?
Guns in the hookah. What's up, brother?
What's happening?
nothing much. What's going on?
Kiwis are great.
Oh,
What?
Oh,
what is
shit.
that?
Kiwis.
Gosh,
So, if you're in a
yeah,
bug out
a lot of
situation.
female.
Yeah,
Really?
if you're in a bug out situation and you're female, you have to go
Oh, okay.
Did you
Go to
wash
the
it?
restroom. Okay.
instead of taking everything off,
There you
I thought
go.
it was a cake frog.
Did you wash it?
point it this
I thought it
way.
was like to pour liquor into a
Yeah, right.
bottle.
And you go to the bathroom. There's so many things that you could
Wow.
use.
So I'm
And
gonna
I-
say
So you should do a one on that, just the specialty items you needed.
Yeah, got it right there.
There you go.
Everything.
So we had to make one for a female in our unit when I was in Afghanistan
Wow.
because every time we would go out, we would always get shot at. So
Oh,
we were
wow.
trying to figure out ways to make sure that she, didn't get hit because she had to go to the bathroom. We would stop and just hop out, watch each other six, and then go pee and be done. Right.
Yeah.
For her, it took like 5-6 guys to goddamn, stand
Mhm.
around.
A perimeter, yeah.
Right, so she could go use the bathroom. Well, somebody came up with the idea with a milk carton, and they cut the milk carton out at the hole at a certain way to adjust her her private parts.
Improvise.
And instead of hopping out and having a squat, she hopped out, undid her pants, stood up, and used it, and went and held the little handle as the handle for it, so she didn't
There
even
you
have to move it. So it worked.
There you go. Improvise.
Improvise, yeah.
Technically, it's smart.
There
You
you
don't have to take up too much. You don't have to put your gun down because
Nope.
you might
She didn't
have
have to do that. She didn't have to do none of that. It was
There you
perfect.
go.
So, yep.
I'm sorry, but I'm not keeping that in my bag. I'm sorry.
Well, this is
It's yours.
You're a friend of the family, yeah.
I'll let them keep it in their bag.
Right, they can
I don't want
Yeah,
nobody coming
that
and
ain't
look in
for
my
us.
bag and seeing I got one of them in my bag. I'm sorry, I can't do it.
They got to do is say, I'm a girl dad.
There you
Okay.
go. There you
I
go.
mean,
Girls. I got my girls. That's it.
Yeah.
This is a saw, believe it or not.
Yeah, that's one of the ones. That's the one I have.
yeah, me too. I got that one.
Yep.
Makes a nice garrote also.
Oh, bruh. If it'll saw wood, it'll saw neck. Trust it.
Or
That's what I just said, yeah.
the
Makes a nice
sheeness. Is
garrote.
that what you called it? The sheeness?
Yeah, that's what we called it over
The
there.
sheeness, the shiwi, whatever.
What's good, Guns in the Hoop?
Not much, man. Just chilling. Listening to y'all talk, man.
Mm-hmm.
Yeah. And it's
Somebody called it
survival
Shiwi.
about
Indeed.
what first aid kit to buy and have, Just going over some stuff.
Man, Amazon got a ton of those things, man.
Yeah, they do.
Yeah, but
We ain't taking no hookahs on the road.
Also, K-Fall survival.
Oh, I got a portable hookah too, man. So
I would, he would.
He's ready. He's ready.
Right back.
Yeah.
dude, I got that. Of course, got to have a couple of sticks, and that part is covered.
Right.
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 Yeah, you got to have, even though you have your essentials, you got to have your luxuries, the few that you will be able to have out there.
Right. You don't have too many. You
Yeah.
have a couple.
Yeah, you gotta have your stuff together.
Yep.
at least make you feel a little sane.
Hot Tub Tony says, how does that saw work?
So all right, hold up, let me pull it back out. So what you do is
like one that
Carbon Q is rubbing off on him, man. Carbon Q is rubbing off on him.
So what you do is you have to take it. I mean, I gotta unravel it for a second.
Yeah.
It's like barbed wire, but it's a little thin piece of barbed wire, right? So let's say if you had like wood or something, right? You would just wrap it around the wood and just move it back and forth. You use these little rings on the end for your fingers, so you won't use the actual saw itself.
Yeah.
And you go back and forth, and it'll cut it right in half.
Works really well.
Now it's not gonna cut a whole fucking tree down.
Yeah, it's not gonna cut a
It'll
redwood.
it'll cut a nice sized branch, like something like that thick, something around
It'll
that.
give you enough to start a fire. It'll do enough to start a fire.
Yeah,
build shelter or whatever else.
So
you need,
it'll do what it's supposed to do. So, but just like I said, it's also good as a good weapon too, if you need to.
Yep,
that's good.
So
it's good to have.
Yeah, but it works.
What's the name of it?
I don't know what they call this. I think it's just I don't
like
even
a wire saw.
Wire saw.
Yeah,
I think it's just called a wire saw.
Yeah.
But it'll do what it's supposed to do. I promise.
Yeah. And it's small and compact. So
Compact, and
it's good to put in your bag, multiple bags. You just drop it in there.
Drop it in there. Yeah, you ain't got no space. It's not taking up no space at all.
Yeah. That one carbon has that you unfold is good as well, but that's just really mobile. If you're traveling light, yeah.
Yeah, if you're trying to travel light, you don't want that big ass thing.
Well, that's good to know. We covered a lot in the ground.
Somebody call me a hitman.
So, Diesel, what have you seen in first aid uses in your everyday?
We pretty much covered everything, man. It's just what I see more than anything is the misuse of a lot of the first aid. I mean, that's what I see more than anything. A lot of people carry this stuff around; they just don't know how to use it.
Don't know how to use it.
Narcan is one of the big ones I've seen here lately, where people are just using Narcan and they have no reason to use it.
Yeah.
They just feel like a person's going to overdose because they told them they took this much, and they'll give it to them before they even fall out or anything like that.
Yeah.
And then what people don't realize is there's a reason why you get 2 doses of Narcan, because the Narcan will run out before the actual narcotic finishes its high.
Exactly.
So I'm trying to talk in the lamest terms as I can. So narcotics, let's say narcotics, you get an 8-minute high off narcotics. Well, Narcan will only keep you for 4.
Exactly.
So that's why you get 2 doses. You give that first dose, and if they fall back into their overdose, you give them the second dose.
Exactly.
And if you waste that first dose before you even know they're going on an overdose, you might not be able to save them because the Narcan has ran out because you wasted the first.
Exactly.
And that's the main thing I see when it comes to the first aid and stuff like that, misuse. Just like I said earlier, people just don't know when to use CPR.
Yeah.
I walked up to a lot of, I don't know how many times, and I'm just like, why are you giving them CPR?
Yeah. Did you check a pulse? Yeah. Did you?
They didn't check a pulse. The person's still breathing.
Yeah.
They're still breathing and they're giving CPR.
Yeah,
so it's like, those kind of things are what I've seen. That the reason why I want to come on here, because I just want people to know, like, you have to know how to use, if you're going to carry it, just like a gun,
training.
You have to know how to use it.
Education training is key. That's the biggest thing. Like you said, I think I started out with that. The first thing you have to do is get that information and knowledge before you even get the stuff. Get that information, and then go out and practice it. And I'll try to use it when necessary. But you got to get the information first. You got to know what you're doing, because you could do more harm. You should never do more harm in any circumstance. So with a gun,
sometimes it's best not to do nothing if you don't know what to do.
Just watch. Just watch. Monitor that you're there. Exactly.
Right.
You're right.
Right.
But you got a better chance.
It's good. It's better for you to be there to tell EMS or whoever's there that's qualified that this person fell out 2 minutes ago, instead of you hurting them more and they're trying to fix what you've already started.
Yeah.
One of the other things I see is, like Poindexter said, latex glove. We had to switch to nitrate gloves because we were the first one on scene, and people were going in anaphylactic shock because we were using latex, and we didn't understand why. But then when EMS came to us, they was like, "Look, y'all are using latex. This is hurting us more than it's helping us. So let's switch those gloves."
Let's switch. That's important.
Yeah. That's so true. Is there a difference between like the service and civilian side where there's life-threatening survival and lawsuit-threatening survival? Which ones? No, it's all the same.
Good Samaritan law. They call it the Good Samaritan law. You
Okay.
can actually act in good faith to try to help somebody, and you are covered in a lawsuit.
Gotcha.
But is that across the board nationwide, or is that just for your state?
I'm pretty. Don't quote me on this, but I'm pretty sure the Good Samaritan law. I'm just gonna say my state. I know for sure my state. I don't know if it's nationwide.
Because I mean, it's stuff like
I've
that.
I've seen some new cases come out, and it's like, I thought that was a nationwide thing, and it's not. So I'm not going to say it's nationwide.
And the thing is, you can't go outside your scope of practice either. This is supposed to be first aid. You know, I've put in chest tubes, I've done tracheotomies, I've intubated people, but in certain areas, like where I'm at now, since I'm not in the military, I'm not an EMT anymore, I can't just go and intubate a patient. I can't go and do, put in a chest tube or do a thoracic,
now that might be something you might do for a family member, but not a
yeah, but you can't, because then that's going to be a lawsuit.
Right.
That's going to be a lawsuit.
That's why I'm asking, life-threatening and lawsuit-threatening,
Yeah.
That's the difference.
See, like me, I only thing I'm good on is Narcan and first aid, and even with first aid, I don't give breaths. I just do the compressions.
Yeah.
I don't feel comfortable giving breath, so that's why I don't do that. I let somebody else.
Nice knife.
What you got there, Guns?
That's nice. That's nice.
What knife you got there?
This is just a shred. This is the one Carbon had. We got the same one. She actually ordered these, and she was like, "I got you one too," and I was like, "All right, cool." So
what's that one you got, Guns and Hooker?
Kukri knife.
I love those.
Nice.
I love those. I love those.
Where you get yours from?
I got this at a gun show.
Yeah. We train with those in our studio and collie sticks and all that stuff. I love those. Those are just nice.
Crocodile Dundee.
Crocodiles. Look, I'm over here showing this. He said, "That's not a knife."
This is a knife.
This is a knife.
It's not significant weight.
Gun cats don't know about no Crocodile Dundee.
Right.
For that though.
Yeah.
Huh? Say what?
Can you come with a sheath?
Yeah.
Yeah.
Okay.
Yep.
Most good ones. So.
Yeah. Like I said, man, this has been a good one, man, and I'm gonna work on getting my StreamYard up where I can add more people with the max I can have in today. But boom, we got Carbon Q back. Anybody want to iterate anymore?
All of that stuff, just make sure, we're showing it to you, but that's because we're comfortable with that equipment. So when you get your stuff, make sure you acclimate yourself to it.
Exactly.
Stuff on YouTube for you to get. With all that stuff, also make sure you have body armor, a good gas mask.
Yes.
Try to get the canister that's all-purpose. There's one that's 15 different things that you can use it for. Riots, chemical. The fire one is a little bit tricky, but they do have those for those, and you could just take it off whatever incident that you might be in and replace it with another one. Try to get one that has a straw. If you have to drink, you don't take it off, contaminate yourself.
There you go.
And that is visible from the sides. Sometimes they have ones that they look good, but you can't see out of the peripheral.
Yeah.
Make sure you have one that has a all-around view, and always check it.
Smitty's asking what website you get that off of.
I got this one actually when the pandemic first hit, so the only place that I could find it was on eBay.
Mm-hmm.
And they actually had quite a few stuff. So I got my
that is nice.
my body armor in this one. I was looking for my canister, but it's upstairs. But
and you can drink out of that, right?
Yeah.
Yeah, you could drink out of this one. And always have your equipment ready for use. Like these should be turned on this side, so when it's time to use, you just put it on your face, get your seal, and then you just pull it.
They have different canisters for different agents, biological.
Yeah.
Okay, cool.
eBay, Smitty, eBay. And if you have little ones, they also have gas masks for little ones.
What's funny is I just found a site today. Let me see if I can pull it back up. Give me a second.
Somebody put it down there.
One kit is also a good tool to have, because if your gear rips or something like that, your what's the thing I forgot? The tarp.
Yeah.
Just a quick sew, your bag, your straps, your molly, whatever
There you go.
clothes. Yeah, actually, you just want to go ahead and hem that up because you're not going to have a lot of clothing with you except for what you have and maybe a change of clothes.
There you go.
What
You
kind of
wanna
body
make-
armor are y'all carrying?
I got level 4 plates.
You got plates. I'm talking about plates or soft armor. That's basically what I was asking.
Yeah, I'm still
So I
locking
do
on
soft
that.
armor because it's so much lighter than plates. But
I got level 4.
okay.
I got
my
level,
next,
I got level 4s on mine too. My plate.
Mine are level 4.
Y'all be careful with those level 4s, man. They crack.
What, the ceramic ones or
This is, yeah, mine's not ceramic. This is heavy, but
Yeah,
plate, steel plate?
mine has that mesh type.
Okay.
Myra
All right.
Safety. That's the name of the
Mine's
company.
Kevlar. Huh? Okay.
Yeah.
The name of the company was Myra Safety. They have all kinds of masks that you can get for babies, kids, everything, man.
You said Myra Safety?
Myra,
Anything you want to iterate, Guns and Hookah,
About
Gas mask, body armor.
well, yeah, M50s are good. You can check out avonprotection.com. They got some masks, M50 masks. They're about $250. You know, full suit. And one of the biggest things, we like armor plates. I don't have any armor plates, and the reason I don't have it is because of weight. You know, you're already gonna have about 50 to 70 pounds of, you know, payload. So last thing you want is another 20 pounds of plate. You know, granted, okay, I may get tagged in the chest with a round and I'm done.
Yeah.
But it's not like anybody who's wearing a plate is going to just skip through a barrage of it around.
Right.
Yeah.
You know what I'm saying? You get hit with the right round, 7.62 by 51 NATO, they hit you in your chest. You're going to feel like you got hit with a sledgehammer anyway. So you may not die, but your sternum is going to be jacked all up. You may have some busted ribs. So I'm like that. And then all that, this is less weight. And then you think about the heat. You're already going to be, let's say you're in a contaminated environment and you got all that stuff on. You got your mask. You may have a hazmat suit on or MOP level 4, whatever. You're already going to be hot. You really want those plates on there. You know, when it's already difficult to breathe. Now you got plates that makes it even more difficult to breathe, especially in the circumstance where you actually got to get several clicks through a contaminated area. Yeah. Sometimes, you know, it depends. You know, everybody's different, right? So I'll probably be the only guy out there probably being laughed at not having any plates, or I might have soft armor, right? That might be that's a better bet.
We're just talking to the basic people, you know.
Right.
Yeah.
You gotta pick and choose and have an option, because if it's having fire outside, you might want to go ahead and put that on.
Yeah.
And take your chances. If not, you know, you could put on the soft plates and keep it pushing. So you have to be aware of your surroundings. Binoculars is also a good tool to have.
Yeah, if you're stationary, or maybe if you're stationary, probably the heavier body armor. You're mobile as far as in a vehicle, maybe. But if you got to walk anywhere, which you might want that soft stuff, because, like I said, you're already going to have about 50 to 60 pounds of payload. Do you really want another 20, 30 pounds? And you might not get hit, especially if you move at night, you know.
Yeah.
Exactly.
That's true.
Fists on the back or pounds on the leg.
Yeah.
And then we're just looking at for the basic people that's wanting to learn, you know, not just prior service, you know.
Yeah, I mean, you could cover essential parts, like you want to cover your nuts and stuff like that. Maybe you want to use something a little bit heavier, but as far as your chest, you know, like I said, it all depends on circumstances. If you're mobile in a vehicle or you're stationary at a rally point, or then I'd wear the heavier stuff, because you're more of a target when you're stationary anyway. But when you're mobile, you know, you're not going to be as, you know, not like you're going to pop up and say, "Hey, look at me, I got AR 500 on, hit me." You know, you're going to want to stay low. You know, so
don't tempt them, right?
Yeah, it's all like I said, it all comes down to it. That's just personal preference when it comes down to armor. You know, with anybody.
Maneuverability. Like I tell everybody, if you're going to dress out, get on your treadmill at your local
with
gym.
that stuff. Oh, absolutely.
Because I do my rope marches. I ain't gonna lie to you. You know, I get one and get on out there.
Yeah.
hit 2 miles, then come on back. That's 2 miles.
Yeah.
4.
2 miles will make you lose 5 pounds easy.
Yeah, especially when you got all that crap on.
All that
But
stuff.
see,
Yeah.
I tell people why to put that crap on. It's not to be protected. It's making sure your ankles don't hit.
Yeah,
Your feet and everything can stabilize.
yeah.
Yeah.
You better put some. Get that moleskin. Get
Yeah.
you a good pair of boots.
Yeah.
Don't go Vietnam jungle boots on nobody. I've wore those many a times. They will beat your feet to crap, man.
Cardboard.
You know what I mean?
Take cardboard.
Get you some high tech or whatever type of boots.
Yeah.
Some especially in wintertime, the Gore-Tex, those are pretty good. Yeah, those are really good boots though.
Cochran's used to be my favorite when I was
Yeah, those are really good.
I used to love Gannon.
in there right
Oh,
now.
yeah.
Like they used to be my favorite boot. They got the mesh on the side now.
Yeah.
Waterproof, but it'll
Yep.
but still got the toe on it in the back part. Bruh, I love
I
it.
tell you, one of my favorite boots were the German tanker boots. Those are really comfortable.
Mhm.
Yeah,
I used to like the jump boots.
yeah, yeah.
The Cochran jump boot.
Some money.
I love those.
Daddy's the one that, look.
Oh,
My dad was the one that got me hooked on Cochran's, man. He used to
Yeah.
wear them all the time, and when I was like 7, he used to make me shine his boots. Before
Yeah, I used to have to do that too, man. I used to hate that. Spit shine them.
7 years old,
Yeah.
spit shining some boots. When I got in the military, I got in the military in 2000. It was like right before they stopped, everybody going in with the black boots and the fatigues and stuff.
Yeah.
So when I was in basic, man, they was like, I was shining my boots like I knew what the hell I was doing, right? Everybody over there struggling.
Yeah.
Bro, I done finished my boots in like 25 minutes, and
There you
people
go.
was going over there looking at them like, dude,
Yeah.
how the hell can I see my
See yourself. Exactly. Exactly.
And you know
That's
why?
right.
You know why they
Right.
cut back on the boots, right? Because of the Kiwi company's contract. Somebody forgot to update it in the military. That's why they cut back for shining
Well,
the
damn.
boots. That's why they start pushing chloroprene.
Yeah, those are.
And
I
then
hate
they
those
went,
things.
then they
Those
went
are-
into the desert camp, and they went into the desert
Yeah,
boots
Yeah.
too. So once
Yeah.
we went to desert, they was like, well, we ain't in the jungle no more, so we don't
Yeah.
need no more black boots. So-
Yeah.
and boy, were they lying. I mean, last I checked, Colombia doesn't have a desert.
Yeah, no,
You know what I mean? I mean, unless the world is. I know the world is changing, but
I know, right?
Not that much.
I didn't know the Amazon had desert strapped around it, so you still gonna need good old tack black.
There
You're
you
gonna
go.
be out there with some desert, especially walking through that water. You're gonna want that good old fashioned leather,
Old fashioned
Yeah.
on that.
walking through swamps. So it's it's still probably there's people still in the world that wear the old school.
Bro, I do.
Yeah.
Like I said, I keep a pair of Cochran's on me. Shit, I have
I like the Cochran
I have
jump boots with the rippled soles. The rippled soles are very
Yeah.
comfortable.
comfortable.
Yeah.
Yeah.
Yeah,
I had a pair of Cochran's as skates. I had turned them into skates one time, bro. That's
Damn.
how much I like them.
Yeah, they're hard to find, man.
you turn them into
Roller
what?
skates?
I turned them into
Skates.
skates. I build skates. I like the skates, bro.
Roller skates? So you be one of them dudes that be dancing on skates and stuff, huh? You one of them dudes that dance on skates?
So what the? Okay,
I like
mean,
the
I gotta see that
bro.
video, bro. I gotta see Amp.
I know.
you got a pair of
You know what? Y'all give me a second. I'm gonna find it. I'm gonna post that shit on Instagram.
It said daggone Ampu got some daggone Cochran Heelys and whatnot.
There you go. That's funny.
Y'all laughing?
Y'all are crazy.
Oh, man.
Said, man, I gotta get down this hill fast. They coming.
I
The
know,
enemy's
man.
coming. The enemy's coming.
Hey, you never know. That might be a
Never
thing.
know.
Shoot.
Look, improvise, right?
Tap the skates.
Got them skates on.
Your feet some boots.
That's funny.
Survival skates.
That's
I was
funny.
going to say the survival skates.
Oh,
Come with an ankle holster.
Oh yeah, you can kill them out, man. You can kill them out, man.
That'll
Have you a
be-
knife in the other one?
Hey, you know what threw me off, man? Have you seen that video where Eric Petway is on a 20-inch bicycle shooting?
Yeah,
I haven't seen that one yet.
Yeah.
Man, he's wide open on that bike. He's standing
Oh, yeah.
up.
Yep.
I was
What?
like,
That's the only way to do it, though. That's the only way
Yeah.
to do it. I've seen a few
Yeah.
people do that before, but yeah, that's
Yeah.
the only way that I've seen people do it anyway. I'm not
That's
doing
crazy.
it.
I'm not doing that. Shooting a full auto Glock
Yeah.
10 mil Glock
I'll
20.
be eating
It'll
dirt.
be my luck. I hit a rock and that thing.
Oh yeah,
back
that's
on me.
yeah.
You know what I'm saying? I ain't doing that.
No, I'm not that nimble, man.
It bent over like a scorpion. Feet all in
Right.
the back of your head.
Be cool for the first like 10 seconds. Next one I know, cut the video, cut the feed.
Right. Right.
Yeah. Oh man, what's going on? AAF, how's it going?
Yeah.
Yeah, definitely right about that hot tub. Eric Petway is definitely built different.
Yeah,
That
yeah.
dude.
And he's like so like mild mannered. All right, guys, I'm about to shoot this Barrett M107 out of my living room into my backyard.
Right.
Oh, you ever seen the latest ones when he's in a suit?
The MP5, dual MP5s, and he comes up with dual
Guns out of
MP5s and like,
his truck.
what? He's in, like, yeah, out of a suit. Yeah, I'm
Yeah.
like,
He's in the
man.
back behind his truck pulling stuff out.
Yeah, did you
guns
see when he
out.
pulled out the two MP5s out the back? I'm
Yeah.
like, what the?
Yeah.
Then he just walked up. Brrr. I'm like, man.
Then he's like, all right, guys, thank you.
Thank you. That was good. That was fun. That was,
And that trailer he's carrying around on the back of the truck. I was
he's a
like,
bad
wait a
dude.
minute.
That's
Yeah,
a bad dude.
he a bad one, man.
Yeah,
He's a
different
bad
breed.
dude.
He got some toys. He definitely got
Yeah.
some toys and some skill sets.
Oh, definitely. Definitely.
Yeah, man. But y'all just take time out to go to cavecarssurvival.com to check out first aid and survival items. And, you know, I'm going to wrap things up and enjoy everybody showing up today.
That's nice. I like that one. I like that.
What
Thank
was that? Show that one
Hey,
again.
man, hey, I gotta show something before y'all get off there, man. I ain't
I
showed
like
nothing all.
that.
I'm
I like
showing
that.
something. Okay, this is the only thing I got to show.
Ooh.
Bench
Whoa.
made. That's
Yeah.
all I
Where'd
got.
you get that
Nice.
from? Hey, where both of y'all get your knives from?
Well, I got this from I got this also at a gun show. Just like unique pieces, and it was relatively sharp. And I was like, "Ooh, sharp is good."
That's a Japanese blade.
Yeah.
Mhm.
Tonto?
I forgot what you call it, but
Tonto?
that's the what?
Which
Is that a
one?
Tonto
His
blade?
or mine?
Yes.
That's a,
You see the end of it? It's a reverse
Yeah,
Tonto
Tonto.
blade. Or is it?
Yeah.
Yeah.
It's Tonto blade, yeah.
Mhm.
that's nice.
I love
Mine I got
Tontos.
off. I got mine off of Blade HQ, but it's law enforcement only because it's an auto knife. So
Yeah.
I mean,
Yeah, these
Right.
are. This is the auto knife as well. It's like,
Yeah, I got one like that as well. Yeah,
man, I want to get one in a Tonto blade as well.
really nice blade.
y'all see how Carbon Q pulled that knife out? Y'all go
Yeah.
back
She
and
just
watch that. Go
smooth.
back
She
and
didn't even
watch
just like,
You
That
got
was
Ben
That was
shooting
straight Brooklyn.
running.
That was straight Brooklyn right there.
Look, hey,
I know, you don't even notice it. Next
Little
thing you know.
get up on me.
You know what I mean? She pulled out. Hey, wait, hey. MHP came back.
I gave
Uh-oh.
y'all. I had to get one for y'all.
Oh,
Ooh.
Ooh, that's
Butter
a
knife.
butter knife.
Man, you can't get no tactical with peanut butter and jelly in this.
Oh, you gotta get that butter knife on you. That's crazy.
oh man.
That's crazy.
Yeah,
You
you
can actually
definitely,
sharpen a butter knife pretty sharp though.
Yeah.
You can
Yeah,
use a butter
good.
knife real
you
sharp.
can.
It is
You
so-
can.
Yeah.
All right.
Surprisingly, what another knife is sharp is a cake knife. Those are pretty sharp too.
Oh yeah.
All
Yeah.
seriousness.
Oh, yeah.
Those bad boys will chop you up.
We've all
So-
been stabbed by one of them, I'm sure, in the finger.
I got cut on a blade on a cake knife. I was like, what the hell? I was not
This one right
expecting
here.
that.
This is my old faithful right here.
Yeah.
Ooh,
What's
This
that?
one, Spider Coat.
I like
I love
spider
this
coats.
Wow,
Yeah.
that's nice.
yeah.
Well, I'm at my limit.
I've had this knife since
Okay.
2004, and it's
Y'all have a good one.
Do the
Oh,
same,
All
man.
right, fam. It's been
good,
good.
Ben.
See you
I
later.
appreciate you
Somebody.
bringing me on,
Bye,
bro.
everybody.
Stay trained up, everybody.
All right,
Yeah. Appreciate it, y'all.
later.
Bye, y'all.
Appreciate it.
You good?
Y'all take care.